K-MITS POH Eric Tayag. From DFA, we have ASEC Eric Tamayo. From DFA, we also have Bien Janine Balocating. From the DICT, we have Mr. Paul Alcala and Yusek Emmanuel Ray Caintic. I apologize, sir, if we're not able to recognize everyone. They could raise their hands. Well, thank you, sir.
Yes. Whoever was not mentioned, can you kindly introduce yourself?
I'm sorry, sir.
Ayun, Comsec Boyet, you're back. Oo. And anyway, for other resource persons who were not mentioned, can you acknowledge yourself?
Yes, sir. From the Department of Information and Communications, of course, we have the Undersecretary for Digital Philippines. We have Undersecretary Manuel Ray Caintic, and we have Attorney 5, Attorney Omar Sana. From the Department of Health, we have the Director for Knowledge Management and Information Service. We have Dr. Enrique Tayag, accompanied by Mr. Yuli Galo. From the Department of Foreign Affairs, we have Assistant Secretary Eric Geronimo Tamayo. From the Office of the Undersecretary for Multilateral Affairs and International Economic Relations. And he's accompanied by Assistant Director Bien Janine Bacolating from the Office of International Economic Relations. That's all, Mr. Chair.
Yes. Good morning to all our guests and resource persons. Thank you for joining us this morning. So I would like to, first of all, our agenda today is the briefing by the Department of Information and Communications Technology on number 1, the Philippines Digital COVID-19 Vaccination Certificate Portal or VaxCert. Number 2 is DICT's COVID-19 response. And lastly is the progress on the country's digital network infrastructure. For the information of our members this morning, just this week we had a lengthy hearing on the Committee on Health and likewise the Committee on Public Accounts and Good Government. And there are a lot of issues being raised concerning DICT. So this hearing is very timely, and I would like to thank the Committee on Health and Committee on Economic Affairs for joining us this morning. Dahil ang kinalabasan po ng hearing natin ay napakarami pong issues that are concerning the interoperability, the systems in place with vaccination card, and even on PhilHealth. No, this was brought about by the hearings that we had. No. So I would like to ask our members this morning to just concentrate lang on the ICT portion of these issues. No, we already had the lengthy portion on the health issue on the Health Committee, and likewise on the other issues on the public accounts and good government. So medyo let's focus lang on DICT, and we invited Yusek Manny here, who is very much qualified, and this committee had worked with him previously to answer those queries that we still have at hindi ho nasagot nito during the hearing on health, good government, and public accounts. So just to quickly read the opening remarks of the Committee on ICT, as the travel and tourism industry attempts to rebound, again, it is being threatened by COVID-19 virus, this time with the more rampant and infectious variation called the Delta variant. And because of this, there's already a growing clamor and acceptance of the so-called vaccine passports and an increased calls for its mandated use. We had from the news that recently Hong Kong Immigration Authority disallowed the entry of our OFWs when they refused to accept the vaccine certificates issued by a Philippine local government and not from a single authorized source. In this light, many are asking what initiatives and measures that the government undertook to address this kind of situation, and the initiatives and COVID-19 responses of DICT carried out. I came across an article saying that in a virtual town hall meeting organized by the Department of Health a few weeks ago, DICT Undersecretary Manny Caintic stated that the Philippine government is now ready to roll out COVID-19 vaccine passports for Filipinos for international sea and air travel. At present, the only proof that one is vaccinated is the vaccination card issued by the local government unit. According to the article, the DICT has now the vaccine certificate portal that is ready for rollout next month. Thus, the chairman of the Committee on ICT, Congressman Vic Yap, who unfortunately cannot join us this morning, requested this instant briefing from the DICT purposely to update the honorable members of the three committees on the digital COVID-19 vaccination certificate portal, or the so-called vaccert.ph. Their COVID-19 response and to shed light on the possible issues that will arise in the rollout of this vaccination certificate portal. Likewise, for the DICT to give us an update on the progress of the country's digital network infrastructure, dahil connected ho ito on how successful the vaccination certificate portal is connected to the infrastructure that we have. No? I'm happy that we have this instant meeting as an avenue to clarify things and hear out ICT department. So, I don't know if Doc June and Kong Kiko would like to have their preliminary remarks before we proceed with our hearing.
Mr. Chair, can I
Yes, sir. Please go ahead, Doc.
just briefly read this opening statement of the chair? Honorable colleagues, guests, and resource persons, in behalf of our chairperson, Dr. Angelina Helen Tan of the Committee on Health, I am extremely pleased to welcome everyone to this important joint meeting of the Committees on Information and Communications Technology, Health, and Economic Affairs. This is quite an auspicious time to be part of the grand digital collaboration as we chart our effective response and trajectory to pave our way forward and return to a post-COVID life of technological ease. We look forward to a new world of seamless connectivity, limitless systems, and better management against future threats. Indeed, almost 2 years into the pandemic, nothing has prepared us to this roller coaster scenario of mass infection and death, of rising expectations and crushed hopes next, of halted activities, nor of a 24/7 homebound life for refuge and safety from an unseen virus attack. Nevertheless, all institutions of our government have remained steadfast in the search and investment for a solid solution, and technology has offered one of the most viable options to the needed database and systems integration for improved COVID-related information and containment. This is not to say our response thus far has been perfect. Admittedly, our whole of the government technology-based response to the pandemic was launched to a full rollout amidst the accompanying initial flaws relating to data security breach and glitch. Our performance insofar as COVID-19 contacts database and contact tracing solutions has shown great data disparities, far from the seamless and marred by data mishandling and corruption in data confidentiality, which run counter against the existing data privacy and protection. And these inefficiencies were reflected in the uncontrolled incidence of COVID-19 cases and threatened healthcare capacities. Yet, we pin our hopes in the necessity and importance of contact tracing as an effective methodology and tool to control the spiking runaway cases of COVID transmissions. Moving forward, the agenda laid out in today's discussion presents novel breakthroughs in strengthening COVID-19 and vaccine response. This could yet be our hallmark contribution towards crafting a strong legislative framework that will give our people the impetus to obviate the COVID-19 transmission chain and any future threats of such magnitude. We achieve this by being technologically literate and digitally connected to all needed systems, portals, and database across merged functions between national and local governments and public and private agencies. As technology continues to develop and aid us in our survival against COVID-19 and other similar threats, I must say that the future looks promising. After all, we are duty bearers. Even in the midst of this pandemic and in the face of our fears, we will not renege in our commitment to save and serve the people. Maraming salamat. Magandang umaga sa atin lahat.
Thank you, Kong Jun Gato. Kong
Thank you.
Kiko,
Yes, thank you very much, Mr. Chair, Deputy Speaker Gatchalian. I'll try to keep it brief, but on behalf of Congresswoman Sharon Garin, Chairman of the Committee on Economic Affairs, it's obvious that the extended lockdown and the consequence of the pandemic has hampered our economic activities. From the very beginning, the trifocal approach of testing, tracing, and treating required us to identify and to find where the pathways of transmission was. Increasingly, we have had to try to create granular lockdown processes and protocols, which again will require that the vaccine, that the virus's existence can be identified and tracked. Now we have the additional problem of our vaccinated versus our unvaccinated people. Since it is people that carry the virus, it is crucial that we can identify who might be infected and who might be resistant as we increase the need for mobility across our borders, both internal, from LGU to LGU, from neighborhood to neighborhood, in fact, and internationally. So as the virus itself shifts and morphs in terms of its transmission and its variants, we just hope that our capacities increase and innovate as quickly, if not faster, than the virus can spread. Clearly, the need for a stable and strong system to allow us to get our economy back on track and moving is crucial. And any day of delay creates greater and greater percentage of our population that falls into poverty, which shall take them longer to get them out of, generations, in fact, as Congresswoman Stella Kimbo reminds us. At that point, Deputy Speaker Gatchalian, let us proceed with the hearing. Thank you.
thank you, Kong Kiko. And before we proceed, I would like to determine the quorum. Do I hear a motion to dispense the calling of the roll by any members of the three committee?
Mr.
Chair.
Chair, I move to dispense with the calling of the roll on EBCAS.
Second, Mr. Chair.
There's a motion to dispense the calling of the roll. Are there any objection? Hearing none, the motion is carried. Comsec Boyd, are there any other members who just entered the our Zoom meeting so that they
Yes.
could be acknowledged so that we could proceed already?
Yes, Mr. Chair. Thank you, Honorable Deputy Speaker West. Good morning. Please allow me to acknowledge the presence of the following honorable members of this joint committee. We have in attendance, of course, the Vice Chairperson of the Committee on Health. We have Vice Chair Siriaco Gato. We also have the Vice Chair of the Committee on Economic Affairs, who's also presiding officer for this, Kong Kiko Francisco Benitez. We also have in attendance Honorable Adrian Edcas, Deputy Speaker Evelina Escudero, the Honorable Ruth Mariano Hernandez, the Honorable Ronnie Ong, the Honorable Vice Chair of the Committee on Health, Estelita Swansing, the Honorable Vice Chair of the Committee on ICT, Micaela Villago, the Honorable Representative Dalia Loyola, Honorable Representative Stella Kimbo, and the Honorable Deputy Speaker Bernadette Herrera-D.
Okay, well,
thank you.
Thank you and welcome everyone. So, Yusek Mani, can we start already with your presentation?
Good morning, Mr. Chair and other members of the House of Representatives. Today, permission to have some slides shown. My colleague will be the one to share the slides and I'll be
Yes,
and
please go
talking.
ahead. Comsec, share screen.
Today, I will walk you through the efforts of the DICT and latest updates and plans on the Vaccine Information Management System, including all our related efforts on VaxCert-PH, followed by all the work done by the DICT as part of the national COVID-19 pandemic response. But I will take a pause at the end so that I will discuss the National Digital Infrastructure Plan later, Mr. Chair, if that's okay. I will start with the vaccine first and the COVID-19 response. So the first part of the presentation will be on Vaccine Information Management System. It's important to understand the overall initiative apart from simply the vaccine certificate. This BIMS has been directed to the DICT by the IATF through IATF Resolution 85 and 96. For this section, we will start with the vaccination journey, including the various systems DICT has developed to enable the country to reach its national vaccination targets, discussing what they are and what they have achieved thus far. The goal of BIMS, Mr. Chair, is to enable the National Vaccine Operations Command or Center to vaccinate as many people as fast as we can, as many as we can, with the least amount of spoilage, pilferage, and wastage. Thus, a strong vaccine information management system is critical to ensuring that the target population of the people of the Philippines is vaccinated. What that means is being able to get the right reporting and analytics to be able to track vaccine inventory as well as the progress in vaccinating the populace. The COVID-19 vaccination journey follows the processes and activities as displayed in this slide. This part of the presentation will focus on the operationalization of the BIMS, specifically on data management of individual vaccine administrations, inventory tracking, and reporting based on beginning and ending inventory, as well as the computations of days to last and the digital vaccine certificate system. Next slide, please. The slide shows how, next slide, please. The slide shows how these different systems come together in the BIMS ecosystem. From the master listing functionality to vaccine administration using DVAS, to providing inventory status of vaccines per LGU and per brand, as well as the vaccination line list data submission, these all feed to the BIMS data warehouse for analytics and for other purposes, such as the VaxCert-PH, which I will discuss in my later slides. Next slide, please. Part of our work in leading the data management for the vaccine cluster is providing operational dashboards that show the national and regional vaccination coverage data for the entire country. As of this Wednesday, August 25th, this morning, the entire country has already...
Yusek Kaintik, you've became muted.
Yusek, naka-mute kayo.
A part of our work in leading the data management for the vaccine cluster is providing operational dashboards that show the national and regional vaccination coverage for the entire country. As of this Wednesday, August 25th, the entire country has already administered nearly 31.1 million doses of COVID-19 vaccines, with about 17.23% of the adult population representing the fully vaccinated individuals. In addition to displaying the numbers of COVID-19 vaccines administered at the LGUs and regional levels, the dashboards also shows the computed ending inventory, which include the days to last status to determine the remaining inventories for each LGU, as can be seen in the example of the NCR data snapshot. This is being done intricately by referencing and validating the data coming from various sources. As part of the BIMS also, the efforts of the ICT, We have set up an inventory dashboard to help with the executive decision-making being done on vaccines allocation. Data come from the LGUs on a daily basis, and these are submitted using retool application in order to track which LGUs inventories are moving or not. This is regularly presented during the daily morning vaccine rollout meetings chaired by the NTF Deputy Chief Implementer, Secretary Vince Tison. Here is the vaccination. Now let's go to the retool being used by the LGUs for reporting their data. Here is the vaccination module where LGUs enter information with respect to their job performance on a particular day. It shows data per vaccine brand, operator of the vaccine site, local government, national government, and private sector, and the source of vaccines job, national government, local government, or private sector. These data are filled up on a daily basis. Next slide, please. As for the inventory end module, this is where we capture information on the ending inventory of vaccines in doses per brand and lot number based on physical count. This is also segmented based on source of vaccine inventory, national government, local government, and private sector. Mandatory reporting is done every Thursday night after vaccinations that day at the minimum. For the supply received module, this is where local government units encode the information on fresh and new deliveries of vaccine supply per brand and depending on the source of the vaccines received. This includes information on date and time when the vaccines were received. This module is used on an as applicable basis. Meanwhile, the transfer supply module is used in circumstances where there are transfers of vaccine supply from one local government to another. This is also used on an as applicable basis. For the delivery schedule module, this contains, for your information, data to the local government units for them to have visibility over their upcoming vaccine supply. Information comes from the retool platform used by the Department of Health Supply Chain and Management Service. So this tool is being used by our friends in DOH, where the latter encodes information on delivery and the dispatch of vaccines. Here, the data module is where users can find all the submissions they have made with respect to supply, transfer, vaccinations, and inventory end ever since they started using this system. This module provides reports based on a date range preferred by the user. Next slide, please. The monitoring module is the main source of data for vaccination, inventory, supply, and transfers for DICT and regional CHDs for daily dashboard reporting and monitoring purposes. This includes tables for second dose scheduling, inventory accounting, and days to last. Next slide, please. The schedule of dispatches module, on the other hand, is used by the DOH SCMS team when inputting information with respect to the distributions of vaccines made across the country. Each submission includes different vaccine brands with quantity of doses to be delivered. The ancillary supplies module para to sa mga needles at yung mga paraphernalia na iba is used by the DOH SCMS team in inputting information with respect to distributions of these ancillary supplies. The distribution plan summary module is a summary of the distribution information submitted by the Department of Health Supply Chain team and which allows them to edit information as needed. Next slide, please. The ancillary summary module is the same. During the rollout of the vaccines through the LGUs, we have observed that the traditional manual vaccination processes was slow and laborious. As a response, the DICT developed and implemented the DICT vaccine administration system. So, Mr. Chair, ito po yung system na ginagamit ng marami mga LGUs doon sa mismong vaccination. This automates the vaccine data recording and reporting per vaccination site. The DVAS is also in compliance with IATF Resolution 117, as well as other relevant policy issuances. Out of the 1,600 LGUs, 1,300 have already participated in the roadshows. However, currently 96 LGUs have already adopted and are using DVAS for a total of 109 bakuna sites. Okay lang po ito, Mr. Chair, dahil ito pa po ang mga sites that are fully operational at this point. These sites have a total of 301 teams, wherein one lane is able to give jabs to more than 100 vaccines per day. May mga iba nagtatalawang daan na po. The cities of San Juan, Pasay, and Caloocan are among the biggest LGUs using DVAS. May mga iba pong LGUs that are fortunate that they can afford to have their own vaccine administration system. But in the pipeline, 229 LGUs have formalized their interest in adopting DVAS. These 229 LGUs translate to approximately 446 bakuna sites, more or less. And in the pipeline are the bigger cities pa of Makati, Quezon City, and Marikina joining. The adoption and use of DVAS has already led to improvements in the vaccination process at the bakuna centers, such as decreasing the average vaccination time per person by at least 50%, from about 20 minutes, sometimes 30 pa, to just about 5 to 10 minutes. Apart from shortening the vaccination time and eliminating the processes of painstakingly encoding individual vaccine records every night after a whole day of jabbing, pagod na po yung ating mga vaccination teams. So ang gusto po natin, pagkatapos ng araw ng bakuna, uwi sila at yung datos automatically nasa amin na po. Apart from that, DVAS searching for names are easy because they can simply check from the master list. Other benefits include increasing efficiency in report generation. Dati-rati umaabot ng 3 hanggang midnight sila makapagpadala ng datos to now just about 30 minutes, reducing errors in reporting and lessening the risk of loss and manipulation of data. Kaya po namin na-generate yung data management kanina na pinakita. Every day po yun. The DICT is also providing close hand-holding with the LGUs and the regions on how to upload the individual vaccination records to the VIMS data warehouse via VAS line list upload tool. For all the data collected starting March 1st to July 11, 2028, 98% na po of the backlog data has already been submitted. As of August 27th, the average LGU submission rate nationally is at 75%, with data quality being prioritized as completeness. We continue to work closely with the LGUs po, training them, guiding them in the use of VAS line list upload tool. But we really encourage many of them to adopt DVAS. Ang main challenge po namin is the availability of equipment. Kasi hindi po natin kayang isupply lahat ng equipment agad-agad for many of our unfortunate LGUs challenged with monetary support. The DICT is also working closely with other agencies such as the DILG to make sure the importance of regularly submitting the vaccination line list data, and they are the ones relaying it to the LGUs. The second part of our presentation will be on the National Digital Vaccination Certificate called VaxCert-TH. Pursuant to previously issued NVOC advisories as well as relevant IATF resolutions, most recently IATF Resolution 134, issued last August 20, 2021. The DICT has led the design and development of the National Digital Vaccination Certificate System called VaxCert-TH. Bila ko, ikom na tubig. Sorry, Mr. Chair. The VaxCert-TH aims to provide digitally verifiable COVID-19 vaccination certificate issued to the requesting individual for whatever purpose it may be needed. The data is being based on the individual vaccination records uploaded by the LGU to the centralized VIMS data warehouse. Through consultative,
Go ahead.
several
Go ahead lang,
consultative-
Yusek Manny. Go ahead.
Through several consultative stakeholder meetings, VaxCert-PH was developed primarily in compliance with the standards set by World Health Organization in its guidelines document called Digital Documentation on COVID-19 Certificates. Kausap po natin ang World Health Organization months even before nila pinpublish ang standard as final. So VaxCert-PH is designed to be accessed directly by the citizens through a web portal or mobile app and can be considered as proof of vaccination status for purposes such as but not limited to international travel. Lalong-lalo na sa mga OFWs na nangangailangan ng authentic, centrally issued by the Department of Health vaccination certificate to be allowed entry into the port of destination. The DICT looks forward to the official public launch of the VaxCert-PH soon. Shown here are the snapshots on how VaxCert-PH will look when generated immediately after your record is found in the VIMS. For the VaxCert-PH to generate the digital certificate, it relies on the vaccine line list data submitted by the LGUs to the central VIMS data warehouse. All the data are made secure through the necessary encryptions and may be cryptographically verified by authorized agencies, groups, or countries. So, ulitin ko po, ang private key ay ginagamit, ang private key held and administered by the Department of Health alinsunod sa World Health Organization standards, ang ginagamit para i-encrypt. Ang public key, i-disseminate po natin sa mga grupo such as IATA, AOK Pass, ICAO, AirAsia, Cebu Pacific, at kung sino pang gustong gumawa ng third-party wallet app. Marami pong gustong gumawa nito. Ibibigay po natin ang public key para pwede nilang ma-decrypt ang vaccine certificate na inisyu ng Department of Health. As mentioned, it strictly adheres to the DDCC guidelines of the World Health Organization para internationally recognized siya agad-agad, making the VaxCert-PH ready to be part of global trust network of the digital vaccine certificates and interoperable across borders. During the course in designing and developing of the VaxCert-PH, several options were considered carefully. VaxCert-PH is a configuration of an open source software that has proven to work for issuing 600 million vaccine certificates in India, and has been used as a reference implementation for the World Health Organization DDCC standard. This approach gives the most significant benefits in terms of full ownership of government of the data and source code. So simulat sa pool, ang ating VaxCert ay pagmamayari lang ng gobyerno, pati ang datos. Flexibility to integrate with other systems and wallet apps. So as I said earlier, we can integrate with anybody who wishes to subsume the digital vaccine certificate. And the major variable is the timeliness and quality of the data being uploaded in VIMS. So reliant tayo sa masuging pag-upload ng ating mga line list ng ating mga LGUs. The VaxCert-PH can be loaded into digital wallet apps that are created by trusted sectors such as airlines and airports. Next slide, please. In order to streamline and optimize the user experience, we engage several stakeholders: Department of Health, Department of Interior Local Government, DFA, DOT, DOTR, that are all members of the sub-technical working group on the digital vaccination certificate. This working group is chaired by the DICT pursuant to IATF Resolution 134, but we are closely coordinating with all the member agencies. We have also asked the participation of private sector companies called T3, consortium of private sector companies, T3, who have been advising us in COVID-19 response, simulat sa pool, as well as members of the task group on demand generation and communications in order to lay out effective communications campaign around VaxCert-PH. The next few slides will show you the screenshots of VaxCert-PH, which has been formalized through issuance IATF Resolution 134. The slide shows the contents of privacy notice. The user inputs the necessary details. Next. The personal information are needed in order to verify their qualifications or eligibility to generate a VaxCert-PH certificate. The vaccinee will be asked to review all inputted data. And once all these pass the verification process, the individual will then see a display of their own vaccine certificate. The system will be owned by DOH, and DICT will continue in providing technical assistance pursuant to the orders of the IATF. And this is also in consonance with the World Health Standard. It has to be owned and operated by the Ministry of Health of a country. Policy-wise, a joint administrative order is being finalized as soon as the comments are all in from all the stakeholders and will be issued by the member agencies VaxCert-PH Sub-Technical Working Group, hopefully prior to the full public launch of VaxCert-PH. The third part of my presentation, Mr. Chair, will be on other contributions of the DICT as part of the COVID-19 pandemic response. Next slide, please. Hindi lang po yung vaccine ang aming tinutukan. The DICT has been providing continuous support and technical assistance to the DOH for the latter's ICT requirements as part of COVID-19 response. Part of the support provided is the technical vetting of various COVID-19 ICT solutions, as well as the development and or rollout of select ICT systems. Next slide. This slide presents a list of the DOH-owned ICT solutions that DICT has provided support to. So ito po, pagmamay-ari ng DOH ang mga systems. Unahin ko po ang pinakataas, COVID Kaya. Ang COVID Kaya ang nagsustore ng lahat ng datos nung nagkasakit, gumaling, nasawi, yung kanilang mga nangyari sa kanilang hospital. Sa hospital or sa quarantine facilities. Number 2, COVID Document Repository System. Nandito po bumabagsak lahat ng mga RT-PCR test results from all the labs in the nation. Faster feasibility analysis of syndromic surveillance using spatio-temporal epidemiological modeler. Yan po ang ating ginagamit for the rich data analytics that is being used by NEDA and the IATF to decide kung mag-ECQ, MECQ, etc. Marami pang iba. Sige, ibaba na lang natin. The DICT has not only supported the DOH for its COVID systems, but we have also provided support to the national government agencies such as the DOST and DSWD in Rapid Pass and Relief Agad in the first SAP implementation before. Next slide, please. The DICT, as chair of the IATF Sub-Technical Working Group on ICT Solutions, also leads the Data Resiliency for Ease of Access and Management Team, or DREAM team, for short, in deploying, building, capacitating, and monitoring the use of all the COVID-19 ICT solutions. So, kanina pong table ng lahat ng mga sistema ng DOH, DICT po ang tumutulong along with all these agencies sa pag-train ng lahat ng mga LGUs na gamitin yung mga yon. Finally, the DICT chairs the IATF Sub-Technical Working Group on ICT Solutions, which recommends the policies and strategies to the IATF principals in order to facilitate efficient processing and integration of data coming from all the ICT solutions. Thank you, Mr. Chair. I will reserve the digital infrastructure plan later na lang po, Mr. Chair.
Okay, Yusek Mani. So before we proceed to DOH, I would like to request our colleagues who wish to interpolate or ask questions. No, the chat box is open. You could freely list down na lang. No, so we already have DSBH, Kong Ronnie Ong, and Kong Jing on the list, so feel free to list down. So we'll just ask DOH for your comments, views, or if you have a related presentation.
Okay. Thank you, Chair. This is Dr. Tayag.
Good morning, Doc. Yes,
Good
please go
morning sa
ahead.
inyong lahat. Okay, maraming salamat. Thank you sa presentation ni Undersecretary Intik. It is correct. We have been working closely with the Department of Information and Communications Technology since the start of the pandemic. The Department of Health shares responsibility and accountability for all information regarding the COVID-19 vaccination. And while Undersecretary Kaintik has provided statements on the support for the other applications, tools, ICT solutions for the COVID response, we are now focused on the COVID-19 vaccination to allow policy makers, program managers to get the data and information as timely as possible so that the vaccination and its completion will be actually documented digitally. For many months now, the Department of Health has also strived to get these many information systems at work. In fact, for the logistics supply chain, we were able to use a system that allows us to track the distribution of these vaccines in coordination with the DICT. We also have a quick count because we were able to develop our COVID-19 Bakuna Center Registry, and this allows the National Vaccine Operations Center, the NVOC, to get timely reports so that this will help them or assist them at least on where the distribution of the next batches of supplies in coordination, of course, with the team on logistics and supply management. Now, because the vaccination cards are available through the local government units with the help from the DILG chair, the Department of Health has anticipated that certification may be required in the future as is happening now. In fact, the World Health Organization has set a meeting tonight so that digital documentation on COVID-19 certificates for vaccination will be discussed, and so that there will be clarification on which procedures should be done and not allowed. And we are looking forward to this meeting, and the DICT technical team will be with us tonight. Now, for the VaxCert PH, there were activities that were already implemented because a timeline of a September 1 launch, okay, will be done. And if all the processes needed before the launch are completed, then the DOH and DICT will be on the right track so that the certification of the vaccinations will be made possible. In the meantime, I'd like to inform Mr. Chair, everyone, that the Bureau of Quarantine, which is also an office in a bureau in the Department of Health, has its own system in making sure that when the yellow certificates are required, that their system is actually ready and capable of actually issuing these yellow certificates. Now, there might be confusion because of that particular system, but the DICT, DOH, and the Bureau of Quarantine are making arrangements so that if and when the Vaxxed PH will be actually implemented, the processes would have been harmonized and integrated. And we'd like to thank the DICT for making sure that the DOH is really involved in making sure that these ICT solutions, processes, applications will actually benefit in our COVID-19 response. Thank you, Mr. Chair. Thank you, everyone.
Thank you, Doc Eric. From the Department of Foreign Affairs, can we get your response?
Thank you very much. Good morning, Your Honors. Thank you very much here. And on the way to our colleagues also in our government who are spearheading the implementation of Vaxxed PH. Department of Foreign Affairs is prepared to assist in rolling out the Vaxxed PH. Once we started the rollout of the vaccinations in the Philippines this year, we had anticipated that there will be a need for some sort of certification. You must keep in mind that the so-called vaccine passport is actually not a travel document. It is a certification that can be utilized by travelers on the possibility that depending on the offer of the destination country, that they may avail themselves of lesser quarantine rules, perhaps, and it's not necessarily a prohibition on travel. So we are doing our best to also facilitate access of our travelers, of people who have been vaccinated in the Philippines, to be able to avail themselves of such opportunity. And hence, we are working with BOQ, also through their yellow card system, and also in the development of Vaxxed PH. And we convey our support, and we are prepared to also undertake the necessary representations with foreign governments in the acceptance of the certificates that will be coming from the Philippines. Thank you very much, Mr. Chair.
Asek, do you have a presentation on which the requirements of certain countries, no? Lalong-lalo na yung mga countries wherein malaki po ang population ng OFWs natin. So this committee would like to know kung ano ba yung hinahanap nila so that we could address it in aid of legislation in this hearing this morning. Maybe you can share your insights kung wala kang presentation about that.
Thank you, Chair. Yes, generally, since there's no international standard yet, so we're utilizing, pending the rollout of Vaxxed PH, the yellow card system. So, and just recently, the Bureau of Quarantine has also spoken with their counterparts, with the Hong Kong government, that will accept the yellow card. The unfortunate incident that happened earlier involved the presentation of an LGU card, and this is just a matter of clarifying with foreign governments to be familiar with the issuances coming from us. And so far, I understand, and probably the Bureau of Quarantine will be in a better position to elaborate on this, is that the yellow card is generally accepted. The only other additional requirement is that there will be a certification attached to it, which include.
Asek, how about other countries, Middle East, US, Europe, in particular UK?
Yung sa Europe, they have come up there with their own system, of accepting certifications within their system for domestic travel, and at the same time, each individual European country has also prescribed their own prescriptions as well. And as much as possible, they are adhering to WHO standards and also looking at the emergency use licenses issued by the WHO. And some economies, some countries have expressed also a preference for a vaccine as well. That's unavoidable. That's their discretion. For the OFW heavy countries like UAE and Saudi Arabia, they do request that apart from the yellow card, there'll be also a certification from the BOQ that would also include the passport numbers whenever an OFW travels abroad. So those are the examples that we have, Your Honor. Let me just check quickly on the UK po. And I'll get back to you shortly.
Sige lang, yes. Do you have other presentation or you're done na? Asek Eric.
That's it po. Wala naman po.
Okay, thank you. Thank you, Asek. Yes. Comsec, can we acknowledge the members who came in?
Thank you, Mr. Deputy Speaker. Allow me to acknowledge the presence of the following members: Representative Janet Garin, Deputy Speaker Christine Singson Mihan, Representative Maria Lourdes Arroyo, Representative Kuya Jose Antonio C. Alvarado, Representative John Ray Tiangco, Vice Chair of the Committee on ICT Carlito Marquez, Representative Rodolfo Ompong Ordonio, Representative Alisa Shinatan, and Representative John Marvin Yulsherbo Nieto. That's all, Mr. Chair. Thank you.
Good morning to all our dear colleagues who just joined us in today's hearing. Just to remind everyone that the chat box is open, so feel free to list down your name as we will start the Q&A portion. No, Comsec, are there any other people who wish to present, resource person who wish to present? If not, we'll be opening the Q&A already.
That's all, Mr. Chair. Wala na po.
Okay, all right. So can we call on DS, BH, Herrera D?
Mr. Chair, may I just
okay, Asek, yeah, sige. Yes, yeah, UK,
yes,
no?
back to you on the UK regulations. The entry regulations and requirements generally for the UK, entry regulations requirements depend on the passenger's country of origin, and usually they look at 10 days before the passenger's arrival in the UK. Existing entry requirements apply even for those who have already.
Yes, thank you. Thank you for the information, Asek. Ang tinatanong ko lang is I want our committee to be enlightened kung all countries ba acceptable na yung yellow card or the LGU vaccination card? That's all I'm asking.
The yellow card po.
Magkakaproblema ba yung mga OFW natin na nagtatrabaho and going to that destination? And in your experience, sinong bansa na ang nagkaproblema tayo?
As far as the yellow card po, ang paggamit, and again, probably the BOQ will be in a better position po dito. Yung yellow card kasi po, there are over 196 countries who are parties to this international health regulations. This is the standard that governs the presentation of documents regarding internationally regulated vaccines like yellow fever. No? Hindi pa kasama dito yung COVID vaccine. So based dito sa new standards na pinapropose ng WHO, isasama yung COVID-19 vaccine dito. Pero ang existing yellow card is really for vaccines intended for yellow fever, for measles. So yun ang ginagamit po na temporarily. So acceptable naman po. There are over 196 countries who are signatories to this yellow card system.
How about the LGU cards natin? The LGU vaccination card issued by the respective LGUs?
Hindi po siya for presentation abroad. Tulad doon nangyari sa Hong Kong, kasi marami ito, we will end up having to provide samples of each and every LGU card to foreign governments. Mas mainam na po yung yellow card system na nasa-certify ng BOQ na pag nakita nila yung LGU card, mag-issue na sila ng itong yellow card na kinakailangan for presentation abroad.
Okay,
Mas
noted. Okay, thank you. Thank you, ASEC, for that clarification. May we call on DSBH?
Thank you, Mr. Chair. Magandang good morning to everyone. Well, Mr. Chair, alam mo naman yung concern ko, and I'd like to ask that because nga the last time, yung tungkol sa universal healthcare, it seems na wala pang hakbang na nagagawa ng DOH with regards to the health information system na pwede nilang i-share sa mga hospitals. I would like to know if makakasama ba ito dito or if DICT can help DOH when it comes to this, Mr. Chair?
Yes.
Medyo matagal na kasi yung batas natin and it seems nothing has been happening to that provision of our law.
Yes, Yusek Mani. Just ulitin ko lang ulit, Yusek Mani, no, na a lot of the questions that I am foreseeing this morning is already connected to a couple of hearings that we did this week, no? And marami talagang loose ends and it points out to the DICT. So if you can help us clarify all this issue, no, maging sa PhilHealth, maging sa Universal Health, connected palagi ang DICT. So go ahead, Yusek Mani.
Thank you, Mr. Chair and DS Herrera for the question. Tama po kayo, no? Kung medyo ang timeline po kasi sana nung universal healthcare, alinsunod sa batas ng universal healthcare, si DOH, PhilHealth, and DICT magtutulungan in creating a central database of all patient records. Kung meron na sana noon, timing talaga nangyari, boss ma'am, Mr. Chair, kasi kung meron na sana tayong naging central data of patients or which is the Filipinos, mas naging madali po sana ang even yung pagkalap ng datos ng mga babakunahan at nabakunahan. Kasi instead na mag-rely tayo sa mga line list submission na kailangan pa natin i-check kung wasto ang pagkasulat ng pangalan ng tao, babanggain na lang natin sa tinatawag na isang patient record na sana nakalap na. Pero Mr. Chair, to answer Madam's DS Herrera's question, tuloy-tuloy pa rin po ang aming pakikipagtulungan ni Director Tayag at ng PhilHealth counterpart natin sa paggawa ng universal healthcare. In fact po, Madam at Mr. Chair, yung ginagawa po natin is recursive. It already hopefully jumpstarts yung mga ginawa po natin sa COVID kaya sa Vaccine Information Management System. Hindi po siya masasayang. It will feed into the e-health system that DOH, PhilHealth, and DICT have intended to actually pursue in 2020. Naunahan lang po tayo ng COVID. Siyempre nakatutok tayo sa mismong pangangailangan mismo at the point in time which is to track yung pasyente at saka yung pagbakuna po. And perhaps my dear friend, Director Tayag can also enlighten us on this po. Thank you po.
Yeah, Mr. Chair, parang hindi rin nasagot yung tanong ko, ano bang problema? Bakit hindi siya na-implement? Nasaan po yung pondo nito? Saan may problema? Ay, kailangan natin alamin kung kanino ba nakalodge ang pondo niyan, bakit ba hindi natin nagagawa until now, medyo matagal na po nating napasa yung Universal Healthcare Law.
Mr. Chair, permission to speak.
Yusek Mani, can you answer first before
Okay.
Doc Eric?
The law po, Mr. Chair, Madam Herrera, is clear that the lead po of the effort is Department of Health and the funds po is going to be lodged onto Department of Health po, Mr. Chair and Madam DS po. Thank you po.
Doc Eric, please go ahead.
Okay, thank you, Chair. Thank you, Ma'am. Thank you, Useka Kaintik. I have my staff here. uh, permission to share a slide for a very short presentation, Mr. Chair.
Please go ahead. Comsec, please allow screen share.
Thank you so much. Okay. Mr. Chair and everyone in this meeting, including the DICT and other agencies, I am providing the status updates on the Universal Care Act implementation of integrated health information systems. Next slide, please. Okay. In section 36, it specifically states 36.2 that the DOH and PhilHealth, in consultation with the DICT and the National Privacy Commission, shall issue detailed guidelines on the scope and standards of the following: electronic health records, enterprise resource planning, human resource information, and the rest. As an update on the 22nd of April this year, the Department of Health and PhilHealth issued a joint administrative order 2021-0001 on the implementation and maintenance of an integrated health information system. Next slide, please. As an update, the implementation of the integrated health information systems follows a modular staging approach. You will see on the right of the screen, Mr. Chair, and all those attending this meeting, that we have 4 stages, starting with the initial stage wherein the transactions are mainly paper-based. On stage 1, as contained in the Joint Administrative Order based on the Universal Healthcare Act, Section 36, the following will be available and are actually available, Mr. Chair: electronic health medical records, referral systems management, telemedicine, laboratory and diagnostics, and the rest. For stage 3, this will now be consolidated so that the enterprise resource planning, supply chain management, financial and capital asset management, quality management system would have evolved. And in stage 3, the integration will be through the Philippine Health Information Exchange. The timeline for these stages are shown in this screen, and that in 3 years, we'll be able to have a functional Philippine Health Information Exchange. What is the Philippine Health Information Exchange? It integrates all sources of health information. They are integrated so that evidence from this information are used by policymakers, program implementers, so that there will be better health outcomes. But relative to this, there are some requirements and capacities. For example, in the screen below, you will see that it requires an information communications technology service management, an enterprise architecture, cybersecurity, and data privacy. The recent iteration of the DOH is manifested in the integrated, in the ISSP. Okay, that's the integrated surveillance system program 2022 to 2024. And we hope that the DICT would have already finished the ISSP uh, review, and this will be finalized because this is the blueprint for all the ICT activities that will be supported by many key actors. Next slide, please. Okay. As an update and for the benefit of all present in this meeting, for primary care facilities, the electronic medical records is now functional, and we have the numbers here. For example, based on our official National Health Facility Registry, wherein we counted the number of RHUs, that's 2,590. Close to 88% have already implemented and validated an electronic medical record system. What is an electronic medical record system? This allows the doctor to manage patients seen in their consultations at the RHU so that enough information is actually requested and secured digitally, and these are kept by local government units, and the Department of Health and PhilHealth are able to extract required data, for example, for PhilHealth as the basis for the reimbursements of the primary care benefit package. And for the barangay health stations as well, we have started in barangay stations that were ready and had the capacity, and this is now at 14%. Next, please. Now, we also have one for hospitals. We have called the electronic medical record systems for primary care facilities as iClinics. And for hospital, it's the high OMIS. We are working with the with the Health Facility Development Bureau, also with the Department of Health that issued guidelines. And this particular system improves the operations of hospital, but also gets information from the consultations between the doctors in the hospital and the patients that visit these hospitals. And for the coverage right now, the iHomis coverage is at 34%. The initial module is at 35%. That's the hospital billing system, or HBSYS. For government infirmaries, we also included them, and this is the accomplishment. And just like the primary care facilities and hospitals, the critical concern is infrastructure and the internet connectivity. And we're happy to know that we're working with the ICT, and we have mapped out the facilities in terms of the speed that is available to them and the connections that are needed. And so these are actually counted as gaps, and the DICT will include them in their plans, if not now or in the future. Next, please. There's another section here wherein the DOH and PhilHealth shall adopt efficient approaches to the best advantage of both agencies in the development and implementation of health information system. Mr. Chair, we share with you that there are third-party developers that have actually introduced the same systems, and we had a system to validate them. And as an update, the initial software version to make sure that these systems are integrated and available at no cost to healthcare providers, we have a pilot in the Aklan province, and this is in coordination with the World Health Organization. Next, please. That ends the presentation. I will be available for any questions. We have also introduced telemedicine to our hotline, DOH COVID-19 hotline. We assure the members of your committee chair. Thank you.
Doc, thank you. Yes, yeah. DSBH.
Thank you. Well, hindi pa rin nasasagot yung tanong ko, anong percent na ba tayo ng accomplishment doon sa health information system? Are we saying there's nothing? Talagang zero?
Meron po.
Third party
So
lang.
yung,
So,
opo, Madam Mr. Chair. So,
stage, you showed us stage 1, stage 2, stage 3, through you, Mr. Chair. So, nasang stage na tayo dyan?
Ito po, yung sa electronic medical records, sinimulan po yan, ma'am, noong 2012. So, pinakita ko po na dun sa electronic medical records. Opo. Kasi marami po siyang, ito po.
Mr. Chair, ang specific lang yung question ko dun sa health information system. What stage are we in?
Okay. Marami po kasi, ma'am, na information system. Kaya nga binanggit ko po ito isa-isa. May electronic medical records, may registry. So, depende po kung ano yung information system. Ngayon, ang overall plan po sa universal healthcare, i-integrate po to para hindi po separately, hindi po watak-watak. Kaya ito po yung plano na pinakita namin sa inyo kanina po.
So nasaan na
this
po tayo? Nasa stage 1 na po tayo.
So stage 1, Mr.
Opo.
Chair, through you. So that's
Opo.
why ang sinasabi mo is 2022 to 2024 pa tayo matatapos? Tama po. Ganun pa katagal?
Ay,
Para
yan po yung yan po ma'am ang nasa plano, pero yan po ay depende po sa resources that we have, yung readiness po ng mga LGU, at yung katulad nga ng binanggit ko po, yung sa integration, inunahan na namin kasi ayaw naming abutin pa tayo ng 2024, sisimulan na po namin sa Aklan. Maraming salamat, ma'am.
Mr. Chair, may I address a question to DICT to ask him what he thinks of this schedule? Kasi parang natatagalan ako. And number 2, para rin diretso na yung sagot ni Yusek Manny, anong masasabi niya dahil ang major concern is internet connectivity. So again, babaksak na naman sa DICT.
Yeah, Yusek Manny.
Thank you, Mr. Chair, Madam Deputy Speaker. Dahil nga, well, pangit matupakinggan, pero dahil nga dito sa COVID, nagkaroon po ng opportunity na magbigay tayo ng mga internet connectivity sa mga rural health units. Kung kaya yung aming free Wi-Fi program, talagang itinaling tuloy namin lahat sa rural health units. Doon po kami ngayon nakatutok, ma'am, para itong vision ng universal healthcare magkakadugtong sila para itong mga gamit ng mga rural health units magkaroon ng internet. Sa ngayon po, ma'am, nakapagbigay na po tayo ng 100 internet connectivity sa 100 RHUs. Kulang pa po yan, ma'am. There are 1,600 of them. Tuloy-tuloy lang po ang aming focus. Dati-rati po kasi, ma'am, hindi yan sila part sa aming public places na listahan. Pero dahil nga dito sa COVID, napauna po namin sila. Pero tuloy-tuloy pa po ang rollout ng DS. Tapos in support po of Director Tayag's initiatives, kasama naman po kami dito sa kanilang effort to create that interchange or exchange between all the RHUs. Kung kaya po gumagawa po kami ngayon ng healthcare information exchange kung saan dadaloy lahat ng mga interconnection between all these systems na binubuo po nila, ma'am. Thank you po, ma'am.
So, Yusek Manny, in short, wala pa tayo sa timetable at matagal pa natin ma-reach itong targets natin. Stage 4, 3.
Kung paano po, thank you, Mr. Chair, kung paano po mapaaga to, sir, mukhang kailangan po namin mag-usap ulit ng maayos kung paano namin to mapapareduce yung 36 months po. But we promise to coordinate with Department of Health and PhilHealth on this. But the Department of the Health is our lead on this effort po kasi.
Okay.
Mr. Chair.
Okay, DHBH, go ahead.
Yeah, sorry. Isang point na lang dahil alam ko marami rin magtatanong. Since pinag-usapan na rin natin yung free Wi-Fi and yesterday nasa hearing kasi dahil tinatanong ko yung tungkol sa earmark revenues para mapabilis yung layout ng free Wi-Fi, sana mataas sana yung budget na inilalagay since yung spectrum usage fees hindi naman napupunta sa inyo. Ngayon ang tanong ko, binalik nila sa akin. Ang sabi nila, it's because of the very low disbursement rate of DICT. Parang nasa 20% or 30% lang daw ang disbursement rate nyo. In other words, hindi nyo nagagamit ang pondo nyo, kaya ayaw kayong bigyan ng pondo for the free Wi-Fi. Yung free Wi-Fi nyo ba ng 2020 and 2021, nagamit nyo ba?
Madam Chair, Mr. Chair, yung 2020 po namin, ma'am, fully obligated na po, almost fully obligated na po ang aming free Wi-Fi, 97%. Dito sa 2021, sa 4% pa lang po ang obligation, but many of them po naman po kasi, ma'am, are huli lang namin na po procure, pero for a year's worth kasi po yon of services. So, pag na-procure lang namin yun lahat, that's for the following 2022 worth of, ano po yun, sir, ma'am, 1 year worth of operating expenses po kasi. So we're procuring always for the following year's 1 year's worth of services. So to answer your question briefly, the answer is categorically, simot po namin yan kasi ang dami na po mga public places kami iniilawan. At dahil nga dito sa RHUs, madadagdagan pa po ang pangangailangan po. Madam,
Mr. Chair, our role is very critical and I hope the good chair would also help us. Dapat na-communicate kasi natin yan sa DBM. We have an 11 billion budget for the spectrum usage fees for the free Wi-Fi. Now, yung strategy siguro nyo, USEC Manny, you have to discuss it with DBM so that for 2022, mas maraming maibaba sa inyo para mapabilis naman natin itong stage 1 to 3 natin. We cannot afford to wait until 2024 para makalatag tayo ng efficient na health information system. Maybe through you, Mr. Chair, we could have a dialogue or invite DBM and we could discuss this in particular para talagang yung free Wi-Fi act natin ay ma-implement natin ng maayos. Andyan yung pondo eh. The money is there. Hindi lang sila nagkakasundo kung paano yung disbursement. Now, DICT is saying fully utilized nila. But DBM is saying 20% lang utilization nila. So nagtuturuan na naman. So ewan ko kung minsan mas maganda patawag na lang natin pareho para walang turuan, Mr. Chair. We have to do something about this. I hope through you, Mr. Chair, maayos po natin. And sana magka-feedback tayo dun sa discussion ng DICT, DOH, and DBM with regards to this matter.
Yes,
Thank you, Mr. Chair.
Well, DSBH and to the rest of our colleagues, actually, USEC Manny is very proactive in lobbying for funds way back years ago now. And we have a series of informal meetings together with Chairman Vic. And na-explain naman ni USEC Manny kung saan nagkukulang kasi yung ibang pondo ay napupunta sa ibang programs sa DICT which is worthwhile also, no? But I guess hindi lang priority right now, no? Especially with this pandemic. Sige. So USEC Manny will just do that on a separate time, no? Kasi hindi yan yung topic
Mr.
natin.
Chair.
But noted DHBH, we
Thank you,
think...
Mr. Chair.
Yeah, yes, go ahead.
Pero last point, Mr. Chair, last point po. Yung hindi po pwede kasi yung free Wi-Fi funds galing sa spectrum usage fees. That
Yun
cannot
nga.
be used for any other
Yes.
item.
Yes.
So, ang importante lang is, kasi connected naman siya eh, kasi hindi natin may implement lahat to kung walang internet connectivity, Mr. Chair. Kaya that's also very important na matutukan po natin. And with your leadership, Mr. Chair, I hope we could we could already call on DBM on that. I asked you, Sec Kanda, yesterday. Ang sabi naman niya sa akin, basta nakita nila na fully utilized ang funding, they can release to DICT for the free Wi-Fi.
Okay, at least USEC Manny
Pagtulungan na lang po natin.
Yeah,
Thank you
USEC
very
Manny, nakita nyo naman, andyan din yung support ni DSBH. Tama yung sinabi mo, DS, yan din ang issue ni USEC Manny na brinot up sa amin nga dahil nga hindi ho nila magamit yung pondo na supposedly on that Wi-Fi. But again, let's help him. It's a different issue. Let's help him. And Manny, let's discuss lang with Chairman Vic also and the SBH separately. And we have to act on it kasi budget season na. No? Okay, thank you, DSBH.
Thank you, Mr. Chair.
Mr. Chair.
Yes, go ahead.
Kiko Benitez po.
Yes, Kong Kiko.
Before we recognize Kong Ronnie Ong, I just want to make one pahabol question because it emerged from DSBH's query. No? Dr. Tayag and Yusek Kaintik, the chart that you have has a stage 0, 1, 2, and 3. And I understand the architecture goes through a specific process of sequence, no? But I think for the question that was asked and is relevant to the hearing today, there's a need for a stronger database actually that will show us who is vaccinated, who is not vaccinated, and so on. Is there a way to take out that component or that module from stage 1, for example, and make it already useful today rather than waiting for all the others like the PhilHealth electronic claims processing and so on before we find these databases useful across? Because I think that's DS Herrera, this essence of her question. Because the database, I'll just finish, Yusek Manny. because the database also are part of our problem. And I think we opened it up with the issue of contact tracing and our inability to share databases, our inability to unify systems across LGUs, for in fact simply passing through a establishment. Iba-iba yung QR code na ginagamit, iba-iba yung database ng bawat LGU, iba-iba yung database ng bawat establishment, iba pa din ang nasa ports, and so on. And if we have to wait 4 years for the full health integrated system, it will not be useful as a COVID pandemic response. No, so I'm just asking, Mr. Chair, if there's a way, no, to tweak this so that it is responsive to the more immediate need, no, that we have at the moment. Yun lang muna, sir, and then I give my space to Kong Ronnie because I interrupted the line.
Thank you, Kong Kiko. Before we proceed, I would like to acknowledge the presence of the Chairman of Economic Affairs, Kong Sharon Garin, na nasa bundok pa yata ito. Kong Eric Pineda and Deputy Speaker Strike Revilla. Good morning to everyone. We'll now call on Kong Ronnie Ong. Sorry, yeah, Yusek Manny, sorry, yeah.
Thank you, Mr. Chair. I'd like to answer and elaborate more on the question of
Yes, please.
Congressman Kiko
Yeah,
Benitez.
sure. Go ahead, Yusek Manny.
Maganda yung diagram na ito. Pangit lang to pakinggan. Pwede magtagalog lang, Mr. Chair, ha?
Yeah, go ahead.
Maganda tong diagram na ito. As sabi nga natin kanina, napilit kayong magsimula ng gumawa ng stage 1, EMR, saka claims, at saka maski pa paano, meron na tayong laboratory and diagnostics. Ano ba ibig ko sabihin? Dahil tuloy sa, pangit na ito pakinggan, pero dahil tuloy sa COVID, nagkaroon kami kagad ng mga EMR. Doon sa COVID kaya, yung case files are already in the EMR that USEC, Director Tayag has been espousing. So, alinsunod na po ito sa aming ginawang mga standards with them and PhilHealth. Yung claims din po, make sure na, kumbaga, gumawa na kami ng mga standards kasi nandiyan yan sa stage 0. Wala lang dito nakasulat, pero gumawa ng standards. Nagkaroon tuloy ng laman dahil sa COVID kaya, nagkaroon na kami ng EMR. Dahil sa CDRS, nandun sa charts ko kanina po, nagkaroon na kami ng maraming laman tuloy sa laboratory and diagnostics. So, nagkalaman agad-agad, Congressman Kiko, Mr. Chair, kumbaga napilitan ng magkalaman. Kahit yung supply chain management, nagkaroon din ng laman dahil dito sa vaccination. So, pangit mapakinggan, pero dahil sa COVID, napilitan ng nagkaroon ng umpisahan yung paglalaman nitong mga to. So hopefully nga po, parang it's the good thing that came out of all this squad na napabilis, napaaga ang panimulang gawain dito sa mga sistemang ito. Yun lang po ang aking sagot, and I don't know kung Director Tayag will also agree with me on this in this observation. Thank you.
Permission to speak, Mr. Chair.
Yes, Dr. Eric, but can you make that brief? Because
Yeah,
medyo
very
marami
short
na
lang.
nakalista
Okay.
dito sa atin. Please go ahead.
Tama po, silver lining ng ating COVID response na accelerate na po. Kaya itong electronic health records po, Mr. Chair, magsasampung taon na pa yan. So check. Itong referral system management, ito yung binubuo namin ngayon. Kasama yan sa Aklan pilot. Telemedicine, nakakasana po yan. Laboratory and diagnostics. Meron ng dyan po yung ating CDRS. Electronic prescription sa telemedicine, nakatali po yan. Check na po yan. Human resource information, ginagawa po namin yan sapagkat gusto natin malaman ilan ang doktor, ilan ang nurse, nasaan sila, ano ang kanilang expertise. Clinical decision support, yan po ay evolving at itong PhilHealth electronic claims, nakabundle po yan sa aming EMR. Thank you, Mr. Chair. Maraming salamat din sa DICT.
Yeah, thank you, Dr. Tayag. We'll now call on Congressman Ong. Then after, can Congresswoman Swansing prepare? And then I'm temporarily relinquishing my seat to Congressman Benitez. Please go ahead, Kong Ronnie.
Good morning, Chair. Thank you. Yusek, Manny, magandang umaga po. Hello.
Good morning po, sir.
Good morning. Good morning po, Yusek, Manny. This is with regard to your DICT VAS, Vaccine Administration System. Kailan po ang rollout po natin po for the vaccination cards po natin? If ever I'm hearing na September po ang rollout po natin for this one.
Ay, sige po. Thank you, Mr. Chair. Klaruin ko lang po, I'd like to provide clarification that Congressman Ong. Yung
Yes, po.
DVAS po, yan po yung gamit dun sa vaccination, sa bakuna.
Yes,
sir.
po.
Yung I think ang tanong niyo po is yung Vaxxer TH na po mismo yung pag.
Yes po, correct. Sorry. Yes, correct.
Vaxxer TH po, kasalukuyan po, nagmi-meeting kami ngayon with the NCR mayors. Tapos na po yung meeting with NCR mayors, full support sila. Gusto nga sana namin na September 1, umpisa na nationwide. Pero with the wisdom po of our NCR mayors and the NVO and everybody, it was decided na ngayong September 1, NCR OFW na. Kasalukuyan po ngayon kasi ngayon po, kanina 9 o'clock. Ang 5 po kasi yung aspeto yan, Congressman Ong.
Yes po.
System readiness. So yung paggawa ng system para makapag-issue, tinitest yan, stress test, load test, security. Ang pinaka-critical na nakikita namin yung data readiness. Kasi dependent, ang system could work. Pero pag wala ka doon, it creates the impression na hindi gumagana ang system. Hindi naman maintindihan na common man yun eh. So important yung data readiness. So nililinis namin sa kakayanin namin yung tinatawag na obvious mistakes. For example, nakasulat AZ. Wrong word. AZ lang ang nalagay nung na-upload, pero dapat AstraZeneca. So, kami na lang po ang magta-transfer na yun. Ang tawag doon, obvious rectifications. Pero for example po, Emmanuel, pangalan ko na lang, Emmanuel ka-intake lang ang nilagay ng tao. Instead na kailangan po Emmanuel Ray ka-intake kasi natin sa aking DFA. Ang tawag po doon, non-obvious mistakes. Magbabounce pa rin ang record ko, pero kailangan pa rin ng tao. Will bring the third question, the LGU readiness, Congressman Ong. Inaayos ngayon, hinintay mo ng sandali lang na tayo kasi ang aming gusto is kakayanin, tinuruan na po namin pala ang mga LGUs, no? Pero sana magbigyan sila ng sapat na kakayahan, pati tao, na kaya nilang ma-accommodate mga request para wastuhin ang datos. Again nandoon wastuhin, pero baka dumugin sila po. So, allow us po ngayong September 1 and for a period of, I don't know, I think 2 weeks, 3 weeks po, whatever it takes, ma-perfect dito sa Manila. And especially for OFWs po muna, para maging smooth. At unahin ng OFWs, sila ang kailangan. So, natin ang DILG nito at ang maraming mga mayors. I'm so happy with our mayors in NCR. Sila po ang talagang masugid na tumutulong sa atin. So, yung LGU readiness. Apat po, yung communications. Hindi tayo, iba-iba ang nasa, diba? Tapos biglang marami magdadagsa. So, yun lang po ang aming hinihingi sa inyo, boss. Mr. Chair, Congressman Johnny, na allow us to have adequate preparation for the LGUs kasi katuwang natin sila, one government po, wala na pong LGU dito po. Kayo dito sa ating effort na ito.
Thank you, but the problem kasi Yusek Manny, right now, we're playing catch up. Ang nagiging tanong kasi ng mga kababayan natin from everyone is why are we playing catch up? Kung umpisa pa lang, alam naman natin parating na ang mga bakuna, why did we not prepare for this? Now we're playing catch up, we might be too late according to you, mukhang hindi pa nga lalabas to ng September. While we're doing all of this, nahihirapan yung mga OFWs natin, hindi rin makabalik ang ekonomiya natin. So yung database, very important. Mukhang nahihirapan tayo. As of today, we're still talking to NCR. Wala pa ho yung mga probinsya. Bakit hindi po ito napagtanuhan before nag-start po tayo ng inoculation or vaccination?
Hindi ko po masasagot yun directly, Mr. Chair, pero in terms of the system readiness po, sabi ko nga po kanina, habang ginagawa pa lang ng World Health ang standard, nauna tayo, sir, in fact, on health, na habang ginagawa pa lang nila yung standard, ginagawa na natin alongside. Yung sa data readiness in LGU, sir, I cannot answer for that, but then that's why we are making sure na tapos na po ang po ng maraming LGUs pala, Congressman Ong. Ano na, sir, allow us lang the confidence na na-pick up talaga. Uy, kakayanin on the ground. Yung ano na lang, sir, yung request na lang of the procedures on the ground po, not the system. Ready po ang system, sir, yung fitness lang po, ang training po.
Kasi USEC Manny, as early as last year, ang dami na po sa atin, including the Senate, have been calling for DICT for a vaccination certificate or vaccination card. Kasi kung naumpisahan sana natin na maaga, hindi ho tayo nagka-catch up. Ngayon, medyo late na. More of LGUs are the ones giving us the data instead of nag-umpisa pa lang tayo, nagkaroon na ho tayo ng one system. Just like, as mentioned by Congressman Kiko, yung mga QR codes po natin na health, ang dami po natin finifill up each LGU, isang QR code health system. Bakit hindi po tayo naglabas ng just one system for everyone? Minsan nagkakaroon po tayo ng question kung paano po man tayo nagkakaroon talaga ng true meaning of tracing dahil minsan isang LGU, pagpunta mo sa mall, iba na naman ang QR code. Kaya mga kababayan po natin, nahihirapan po ang smartphones po nila, punong-puno na ng QR code.
Thank you po, Mr. Chair. Noon pong lumabas yung vaccine, yung COVID-19 vaccine law, ang una po kasing inutos, ang una pong inutos at tinutukan natin is yung vaccine administration as well as yung sir, yung nakita nyo kanina, di ba? Making sure na makapagbakuna as fast as we can, as many as we can. Doon po talaga natin tinutok, sir. Kung napansin naman, dahil doon, nakapagbakuna na tayo ng 31 million. So, I'm not, excuse Mr. Chair, Congressman Johnny Ong, pero ang focus talaga namin, sir, was to focus on the making it as many as we can. And then ngayon po, towards around mga June, July, yata yun tinatutok na mukhang kailangan talaga ang vaccine, sir. So, that is of this year na po yun, sir, inutos sa amin, sir.
That's correct po, Mr. Chair, but nagiging problem nga as I mentioned, we're playing catch up from day one until today. Ngayon, medyo gahol na ho tayo sa oras while we're all doing catch up. Our OFWs are suffering as you mentioned this a while ago. Hindi pa nga natin nakakausap ang lahat, mahihirapan din ng DFA dahil it's very important for us to have one vaccination card dahil tayo po ang isa sa pinakamaraming OFW. And nahihirapan po sila. Will this vaccination card be free or may charge po to?
Thank you, Mr. Chair. It is totally free po kasi hindi po maganda na ang bakuna libre sa mamamayan tapos may bayad po pala vaccine, sir. So, libre po siya, sir. And din po sa ating World Health Standard po.
Yun po, I just want to hammer on that, Chair, kasi nga po with our system here, example lang nga yung QR code na sobrang dami, na hilong-hilo na yung mga kababayan natin. Sana matapos na itong vaccination certificate na sinasabi ng DICT at sana ma-roll out within the year. Kung they will be playing catch-up, baka hindi na natin magawa to. Yun lang po, Chair. Maraming salamat po and good morning.
Thank you very much, Congressman Ong. Yusek, I think part of the question of Kong Ronnie also is yung contact tracing QR code system, hindi pwedeng talks to your vaccination system para isa na lang? Or they're completely different architecture?
Thank you, Mr. Chair.
Before I move to Tita Ging, Swansing.
Thank you
Yes.
po, Mr. Yung
Go
vaccine-
ahead, Yusek.
Na,
Yusek Kaintik, please respond, and then Tita Ging will ask her question.
Thank you po, Mr. Chair. Yung vaccine certificate po kasi tumitingin sa isang alinsunod sa World Health Standards, sir, no? Is that kailangan tumitingin sa isang central repository para masabi natin sa ibang bansa, iisa lang ang pinanggalingan ng datos, hindi yung ang dami-daming pinanggagalingan. Kasi hindi naman alam ng ibang bansa sino ang city of X, sino si city of Y. Isa lang, they only sa Philippines. So, ang ating vaccine certificate galing sa Vaccine Information Management System or VIMS database. Yung contact tracing po, kung from a certificate standpoint, baka hindi kailangan for international travel. Baka mas kailangan pa is yung the equivalent for the RT-PCR tests instead. Kasi ang kailangan naman sa ibang bansa is yung latest test result at saka yung state of vaccination. Yung tracing po, domestic concern po siya, sir. So yung pag-synonymize, pag-unify naman ng mga tracing efforts, ibang trabaho, ibang project pa po natin yan, sir. Ang tinatawag po dyan, sir, is yung Contact Tracing Central Warehouse. Wherein, naglabas po tayo ng Joint Administrative Order asking all LGUs to follow a certain format to give to the DOH Central Warehouse. Again ha, DOH lahat to, DICT lang ang tagagawa. Yung ginawa po namin is yung with the DOH is yung Central Warehouse kung saan papasok ang all the LGU contact tracing efforts. So yun po ang aming pinagawa sa amin, hindi yung contact tracing sa bawat LGU, kung hindi para magpasok sila lahat sa warehouse. So tatlo po na contact tracing warehouse, test results warehouse, the CDRS, and the vaccination system. So ang vaccine cert galing sa VIMS, wala pa po tayong equivalent for PCR test as well as yung sa domestic, yung tracing naman po, domestic concern siya po for your tracing effort. Thank you po, Mr. Chair.
Thank you. Tita Ging, Swansing, please.
Damogid nga salamat, Chair Kiko. I have very simple questions lang naman. Gusto ko lang ma-clarify, no? Yusek Mani, what is the difference between Vax Cert PH and the yellow card, no? Kasi it was mentioned by ASEC of the DFA na yung yellow card is already internationally recognized, no? And ang kailangan lang talaga is depende dun sa country, no? So if yellow card, which is 300 pesos, Chair Kiko, no, may bayad ang yellow card sa BOQ. So I am really looking forward dun sa libre sana, no? Kasi syempre libre nga yung vaccine, tapos yung yellow card may bayad. If a yellow card is already recognized internationally, then bakit meron pang Vax Cert PH? So is Vax Cert PH a support to yellow card? Kasi mawawala na ang yellow card? Kasi sabi ni Director Tayag, is synchronized daw ang yellow card sa Vax Cert PH. So medyo naguguluhan ako, ano ba talaga? So that's my first question, Chair Kiko.
Thank you. Yusek Kaintik.
Thank you, Mr. Chair, Congresswoman Swansing. Very good question po. Ang World Health Organization, matanda na yan, ang unang-una niyang ginawang mga regulation, siyempre bago nagka-COVID, is yellow card. So 196 countries members, yellow card yan. Yellow fever, measles, and whatever. Ang komplikado po kasi sa COVID-19, mas kailangan niya ng datos na may first dose, second dose, anong brand, kailan tinurok. So may mga dagdag na mga variances, no? The date, the time, the brand, saan tinurok. Kung kaya ang World Health, gumawa sila ng bagong standard na kailangan sa maging digital kasi parang kailangan yung simple lang. Ma-validate ko talaga digitally kung valid ba to. Dati kasi yellow card, trust system yun sa ma'am eh. As long as mukhang yellow card talaga to, wala naman silang pagbabalingan agad eh. Kung halimbawa, nandun ka sa ibang bansa. So kung kaya gumawa ang World Health ng panibagong standard na nilabas lang noong July 27. Pero like any other standards, ma'am, Mr. Chair, it will take time to be propagated to also 196 countries. We are proud to say that the government of the Philippines is one of the earliest adopters apart from UK and some EU countries. US nga, hindi pa sila nagdi-DDCC eh. So nauna tayo. Now, ang tanong kanina, so bakit natin dalawa? Kasi habang ipinopropagate pa lang po ang paggamit sa ibang bansa, kailangan you have to recognize both. And I think the countries also recognize, so for now, dalawa muna. But for a country na agad din like us, maaga tayo masyado eh, excited tayo masyado eh. So, pag pumunta ka sa UK at DDCC sila, at gusto nilang barilin yung ating Vaccert PH na DDCC compliant, we can be proud to say that pwede siyang gamitin. Pero kung may pumunta ka sa isang country na hindi naman pa, naghahabol pa lang sa World Health, baka alam na rin nila yan, pero yung ano na lang muna, yellow card, parang ganon. So pwede pong to dual po. Kaya yan po ang aking answer lang on that. Parehas po siyang tama kasi may overlap pa in implementation in other countries. Pero tayo, gusto na nating mauna. Saka DDCC standard siya. And lakihan ko lang po ang DDCC ha. Yung DDCC na ginawa ng World Health, standard siya po, Kung Kiko, sa sinabi mo kanina. Apart from vaccine cert, meron pa ba siyang ibang prescribe? Opo. Pati po yung latest RT-PCR results, kasama po yun sa DDCC standards. Pero hindi na po namin yung nagagawa pa kasi vaccine cert lang po ang inutos pa muna sa DICT ng DOH at IATF. Thank you po.
Thank you, Yusek Manny. No? Thank you, Chair Kiko. So, ibig sabihin lang, Yusek Manny, pag lumabas na yung Vaccert PH mo, ibig sabihin implemented na siya, mawawala na yung yellow card. Kasi parang nakakalito eh.
Madam, Mr. Chair, I don't think so, ma'am. Kasi ang nandito right now, COVID-19 certificate pa lang po ang sinabi talaga ng World Health. Ang mga manlalayag po na mga seaman, medyo stricto po sila, di ba? Kasama ang yellow fever, malaria, measles. Medyo maselan po yung mga ganong biyahero. Pero at least for the general OFW or general international traveler, this would suffice po. Thank you po.
Yusek Manny, Chairman Kiko, so ibig sabihin, kukuha pa kami ng yellow card, tapos kukuha pa rin ng Vaccert PH. Kasi the way I understand, itong Vaccert PH will be produced from the VIMS, tama ba?
Tama po, Mr. Chair.
Okay. So, ang yellow card is mag-fill out kami for ano tawag nito? For appointment, 'di ba? Doon sa BOQ na website. And then pupunta pa kami for doon sa BOQ para kunin yung yellow card. So, bakit hindi na lang i-incorporate ito para hindi na parang nakakalito eh. Parang sobra ng hirap doon sa magta-travel or sa OFW.
Mr. Chair, ma'am, as I said earlier po, ma'am, yung BOQ na yellow card, kailangan pa rin po yun for the other kinds of vaccination, ma'am. Yellow fever. Kung hindi ka naman po, kung ikaw'y maglalayag na hindi naman required ang mga measles vaccination, yellow fever vaccination, hindi na po kailangan pong kumuha ng BOQ yellow card, ma'am.
Okay. Thank you. Thank you.
Po, ma'am. Hindi naman
thank you.
Po, ma'am. Thank you.
So hindi pala pwedeng i-synchronize.
At pwede, ma'am, ulitin ko po, ay tama po ma'am. Ang Department of Health po ang may-ari ng Vaccert PH. Kami lang tagagawa. At masisynchronize po siya ma'am. In due time, itong Vaccert PH is also subsumed under the Department of Health's umbrella po. Ngayon lang po, dahil transition, kakagawa lang, kami po muna magmamanage for and behalf of the Department of Health. Pero ulitin ko lang po para hindi tayo maging taliwas sa World Health Standard. At the get-go, it is a Department of Health issued certificate simply administered by the Department of ICT for now. But
Okay.
it is Department of Health issued.
Okay. So it's good to hear, Yusek Manny, na ito ay isahin na lang no in the future kasi para hindi naman mahirapan yung OFWs natin at saka yung mga travelers natin ano. Second question is on VIMS. So itong VIMS ba is a national database?
Yes po, Mr. Chair.
Okay. Ngayon, dun kasi sa mga LGUs na pumayag na, no, konti pa lang. At saka NCR lang yata yung Metro Manila lang yung madaling umoo. So since this is a national database, how do you foresee this for the full implementation? Kasi kung national database siya, kailangan ng mga travelers natin at saka dun sa Vaccert PH nga because Vaccert PH is produced from VIMS, no? Kasi ito yung Vaccine Information Management System. So how do you foresee ang full implementation? Kasi kawawa naman kung itong mga OFWs natin ay galing pa dun sa remote area tapos walang hindi ginamit ng LGU itong VIMS. So how do you foresee this?
Thank you po, ma'am.
And siguro last question ko na is how will you support ang LGU na medyo malayo, mahina yung internet, alam mo yon? So how will you encourage them para gamitin ito? Kasi napakaganda nitong system na to.
Thank you po, Mr. Chair. Ano ko lang, ma'am. VIMS is the overall ecosystem. Yung may iilan na LGUs, kanina hinighlight ko, na gumagamit ng DBAS, yung gamit mismo sa bakuna center. Gusto namin silang inganyohin yun, ma'am, kasi pag upo mo, registration, screening, vaccination, nandun ang datos, ang bilis. Tapos, pag uwi ng alas 5, pack-up leave, nakakapagpahinga ang mga nagbabakuna, the vaccination teams. Pero ma'am, kahit hindi po gumagamit ng DBAS, nakakapagsumiti po sila ng line list sa VIMS. Kung paano nila ginagawa, may mga dalawang klase po. May mga cities like Taguig, may sarili silang vaccination administration. Mayroon silang sariling system, pero sa dulo, yung linya ng mga line list, pinapadala pa rin po sa VIMS. Marami pong mga LGUs na di papel. At okay lang naman siguro for a limited number. Kasi for example, nagbabakuna sila ng 30, 40 sa isang araw, kaya pa nilang habulin. Pero ma'am, lahat po yan nasa VIMS. Pinapasok po yan, ma'am. Pinupukpuk po yan ni Secretary Dizon araw-araw. Lahat po ng bakuna sa lahat ng bansa, magsusumiti ng datos ilan ang nabakunahan nyo at sa dulo ng araw or 2 days after kasi kung di papel, isusumiti mo kung sinong binakunahan mo. So gamit po ng lahat ng LGU na nagbabakuna ang VIMS. Ang hindi lang po nakakagamit yung DBAS. Ang tanong mo, maganda tanong mo, ma'am, sasakyan ko na. So bakit hindi lahat gumamit ng DBAS, Yusek Manny? Ma'am, ang kulang po, ma'am, kagamitan. Kasi po, para po fluid siya, ma'am, may gamit ang registrar, ang screener, vaccinator. Hirap po kami sa pondo, hindi naman po basta-basta makapagbigay tayo sa bawat LGU. No? We ask the LGUs, ay, sagutin nyo na yan. Pero marami po tayong mga LGUs na wala pong kaya, ma'am. So, kahit nga may kaya, humingi din eh. Kasi medyo may kamahalan din po ang devices. So, I implore the help of our Congress friends here to help us even more. Allow us to be able to buy the devices needed. Humingi na po ako ng tulong sa USAID. Nagbigay na sila ng 1,000 tablets. Kahapon, kamitin ko ang Australia. World Health, nagbibigay ng 4,000 tablets. Hindi pa lang dumadating. So baka makatulong yan sa marami pa pong LGUs, ma'am. Maganda po meron yun, ma'am, kasi para po hindi nabubugpog, hindi napapagod ang ating mga vaccination teams. Kasi po, ma'am, yung mga vaccination teams, sila na po nagbabakuna, sila pa magko-contact trace, sila pa rin yung mga nag-aalaga sa mga nagkasakit. Ganun po yan, di ba, ma'am? Multi-role ang mga ating mga katulong sa LGU, ma'am. Thank you po.
Okay, so thank you very much. Klaro na sa akin yung kasagutan doon sa mga tanong ko, no? And I hope Chairman Kiko, we can help DICT, no, with na sana lahat, because this is a national database, sana lahat ay gumamit ng EVAS, no? So thank you very much. Yusek Manny, thank you.
Mr. Chair, may I add lang?
Yes,
Hindi,
Yusek.
yung DIVAS po, at ang sabihin ko lang sa inyo, ang DIVAS at ang VIMS, hindi po siya masasayang. Kasi kahit next year and the following years, magtutuloy-tuloy na ang bakuna eh. Yung gagamitan na yan, ibibigay natin sa LGUs. Pwede naman nilang gamitin na yan for all the other subsequent vaccinations like measles, polio, pwede na pong gamitin sa children's vaccination. So yung mga kagamitan na yan at itong sistema na ito, we are in talks with Department of Health. In fact, VIMS, kaya tawag lang namin vaccination eh. Imagine nyo po na pwede naman po siyang i-extend later on to all the other vaccinations if and so Department of Health warrants to do so. Pero tutok lang po muna kami sa COVID ngayon. Pero yung sistema na yan, pwedeng i-repurpose for all other vaccinations in the future po. Thank you po.
Sige, thank you. At this point, I'd like to recognize Congresswoman Stella Kimbo for her questions. Stella?
Salamat. Salamat, Mr. Chair, at good afternoon po sa lahat. My first question is for ASEC Eric of DOH. ASEC or USEC? USEC Eric.
Director Eric, ma'am, magandang umaga po.
Ay, sorry po. Pre-promote pa kita. Okay.
Okay lang po.
Kasi po, sir, you mentioned earlier that 87.8% of all our HUs are already registered doon sa EMR system. Tama po?
Opo, iClinics is, pero kasama po ron may mga konting third party pong applications katulad ng gawa po ng ibang mga university do. Katulad ng sa UP po yung cheats. Opo.
So it would seem kasi based on that number na parang lahat na ay kumbaga electronic. So ang tanong ko is, doon po sa bawat RHU, diba? So if an RHU is able to register or have its or be part of that EMR system, I guess isn't the relevant question, ilan ang registered users sa EMR? Kasi kanina tinatanong ni DSBH kung ano na ba yung progress natin. Diba? Gaano kalayo na? And ang tingin ko parang hindi masyadong relevant para sa akin. Although it's a nice number, it's very high, it's close to 100. Pero hindi ba at the end of the day, ang dapat binibilang is kung ilan users ang nandun na. Ibig sabihin, ilan na ang taong merong electronic record. Kasi yun ang sa tingin kong totoong basehan kung gaano na tayo ka-electronic, so to speak.
Tama po yan, ma'am, sapagkat ang binibilang kasi namin yung mga facilities na meron na pong iClinics or electronic medical records.
Yeah,
Opo.
which simply means you just have to whatever download or
Opo.
install, di ba? And
Opo.
that's very easy to do, hindi po
Opo.
ba?
Ngayon,
So
dahil
ang tanong is ilan ang
Okay.
Pilipino na nandun na sa mga systems na yan?
Okay. Para masagot po yan, ma'am, ang ibig sabihin niyan, yung mga pasyente na pumupunta lamang sa mga rural health unit, ang mabibilang po na merong record.
Sige po. So ilan yun?
Wala po akong datos ngayon, ma'am, sapagkat yan ay available lamang sa mga local government units. Pero sa ngayon, ma'am, ay tinitext ko na po yung team ko para kasi meron naman kaming ongoing count kung ilan yung medical records na available. Ibibigay namin sa inyo, ma'am.
Pakibigay na lang po.
Per region po, pwede rin
Opo.
po.
And kung pwede po sana unique number of records, no? So kung ako po pumunta
Opo.
10 times, sana isa lang ang bilang. So we'd like to know.
Opo.
Anyway, magba-budget hearing pa naman tayo. Magandang malaman, di ba? Kasi yun ang
Opo.
measure of progress dito po sa
Thank you, ma'am.
iHealth system. Sige po.
Opo.
Thank you po. My next question, Mr. Chair, is for Yusek Manny.
Yusek Manny,
Yusek Manny,
umiinom ng tubig.
nag-lunch na yata. Inunahan tayo ni Yusek.
Sorry, ma'am,
Yusek,
nag-rest.
Sige po.
I think
at
Attorney
this stage,
Omar,
though, I would
na
like
po.
to, Kong Stella, just a second, Yusek Kaintik. Hello, at this stage, I think I would like to turn over the chair and the presiding function to Vice Chair Gato. Kong Gato, please.
Thank you, Chair Kiko. We go on with our meeting. Yusek Manny.
I'm back po, sorry.
So, Mr. Chair, tatanungin ko na si Yusek Manny. Just for clarification, so the entire system is called VIMS. And then the one specific to vaccine registration is the DVAS. May tanong ako, kung gusto mo mag-issue ng VaxCert, dapat meron kang DVAS? Kung
Hindi
ako
po.
LGU, ano ang kailangan ko para makapag-issue ako ng VaxCert?
Para po makapag-issue ng VaxCert, ma'am, yung VaxCert PH lang po. Ang assumption po dun, ma'am, kahit hindi ka gumamit ng DVAS, for as long as yung line list ng mga pinakunahan mo, pinadala mo sa central warehouse, makakapag-issue ka po ng vaccine certificate, ma'am.
In
So,
other words, there are two ways to do the data capture. One is electronically through the DVAS. The other is manually. Tapos isasubmit mo
Manually
lang.
or may, sorry, Mr. Chair.
So, pag manually, isasubmit mo lang yung listahan mo sa DICT at the end of the day, and then wholesale, i-issue yung QR codes, ganon.
Ay hindi po, ma'am. Ang VaxCert PH po, ma'am, upon request of the
Individual.
citizen, we're not issuing agad-agad yung
So through the website.
Ma'am, ang binibigay po ng LGU is yung Vax card, proof lang niya, parang duplicate copy lang niya, nagpabakuna ka ngayon. Parang gano'n.
Okay, now I understand.
Pero ma'am, ang narikina po, ma'am, gagamit na po kayong DIVAS soon. So, tapos na kayo train. So, dati, di pa po, ngayon you're moving towards DIVAS na rin po. Nagre-request po kasi kayo ng gamit po, ma'am.
Okay. So, meron bang LGU sa ngayon na merong sariling VaxCert system? Meron ba?
Wala po, ma'am. Ang meron lang po na mga LGUs may sariling vaccination administration system.
Okay. Sino sila? Ilan sila?
Marami sa NCR, ma'am. Cebu, meron sarili. May sariling vaccination administration system. Marami po, di ganun karami, pero may ilan din po. Mandaluyong po, may sarili. So, simulat nagpagawa sila. Yung para sa mismong bakuna center, ma'am. Para bumilis, para, may queue, may scheduling, para makiwasay yung experience.
Okay, so as far as the vaccination cert is concerned, mas pinupush natin na gamitin lahat ang vaxcert.com. Ganon. Ibig sabihin, yung sa tanong kanina ni Kongging, Swansing, na paano ba natin ma-encourage lahat ng LGUs to use your system. Ako rin sana, kasi parang maganda sana na uniform yung certificate, di ba? Kasi sa ngayon, iba-iba ang card, hindi mo malaman kung i-accept ba yan. Kasi halimbawa, you travel abroad, tapos iba-iba ang itsura ng mga cards mula sa Pilipinas, hindi nila malaman kung paano nila iproprocess yung information na yon. And in the end, hindi na lang nila i-recognize ang any kind of vaccination card from the Philippines. It's very important that we have a uniform card. But it would seem naman na whether or not the LGU uses the DVAS of the DICT, pwede naman pala magamit yung vaxcert.
Yes po, ma'am. Ganun po talaga. Ay, sorry, Mr. Chair. Mr. Chair.
Hindi ka-crucial na So hindi ganun ka-crucial, Mr. Chair, na lahat ng LGUs ay mag-invest in a single system. Kasi so long as long as they submit all the information, is that right?
I'll annotate, ma'am.
But being part of the DVAS, just expedites the process. Parang ganon.
Yes.
That's the biggest advantage. Kung lahat ng LGUs gumagamit ng DVAS, diretso na kaagad, and anytime the citizen asks for a vaxcert, mabilis.
Opo, ma'am.
So that's the most important advantage.
Ma'am,
Okay.
dagdagan,
So
ma'am.
sa ngayon, sige po.
Ma'am, hindi lang mas mabilis, ma'am. Mas mabilis ang magiging pagbabakuna, ma'am. At hindi napapagod, ma'am.
That's the most important.
The sustained speed of vaccination must be kept, ma'am. Pagod sila, ma'am, eh.
Okay.
So you need them back tomorrow.
Okay, so the question is, how do we incentivize the LGUs to use DVAS? May tanong ako, have you costed out the resource requirements for LGUs to be able to use DVAS? Ibig sabihin, di ba sinabi ninyo kanina, kulang sa gadget, kulang sa tao, hindi sila protected, things like those. Ang sa tingin ko, as far as LGUs are concerned, kung alam nila kung magkano yung counterpart on their end, mas magiging bukas ang kanilang kaisipan to use DVAS. So, na-compute na ba ng DICT yun? And siguro yung cost is per 10,000 population kasi iba-iba naman ang size ng LGU. So, ibig sabihin, to be able for DVAS to serve, let's say, 10,000 people, ano-ano ang requirements? Ilan gadget, ilan tao? Kasi, meron po ba kayo niyan?
Congress, Mr. Chair, very good question. Pinapa-compute ko po ngayon, ma'am. Pasensya po.
Sige, okay. Related question.
Ma'am, kinukuha lang po, Mr. Chair, yung numbers po when we
Okay.
ask.
Related question, Yusek. Magkano yung cost ng pag-develop ng isang DVAS? Kasi as you said, there are certain LGUs that would have their own DVAS. Ano ang approximate cost niyan? Kasi that's also the other incentive for LGUs to use your DVAS. Ibig sabihin, hindi na sila maglalabas ng cost of developing their own DVAS. So can you give us an idea magkano ginastos ninyo to develop your DVAS?
Ma'am, sandali lang po, Mr. Chair. Inaalam ko lang from my colleagues po. Ma'am, I think may rough estimate, no? For each LGU, kung gagastos siya, depende sa ganda ng system at saka pag-maintain. Siguro abot sila ng mga 10 to 15 each LGU, di ba? Kasi siyempre, the gravity. Pero kami, 65. 65 po lahat. Itong DVAS lang ba o yung buong week? Sorry po, ma'am. Sorry. Ma'am, marami na pong aspects yun po of this one, ma'am. Nasa mga 65 po lahat. To be enjoyed by all the LGUs po na yun po, ma'am.
Sorry, ano yung 65?
65M po.
65 million.
65 million ang cost of developing divas?
Hindi po, many of the aspects of VIMS na po, ma'am.
That's
Many
the
of
whole
systems na po.
VIMS.
Apo, ma'am.
Pero
Apo,
kung
ma'am.
let's say divas lang, kasi yung VIMS naman, that's really for a macro, for a
Macro
macro
po,
unit
apo,
like
apo.
DOH. Pero kung ako LGU, gusto ko lang ng isang divas, yun yung sinasabi ninyong 10 to 15 M.
Siguro po, wala pang kagamitan po yun, ma'am.
Oo, and then
Exactly.
you're going to give me the costing of the kagamitan, manpower requirement for the
Opo,
LGU to be able to operate a divas or your
Opo.
divas.
Yes po, opo.
Okay, sige, hintayin ko yan. While we're waiting, siguro isang tanong na lang po or observation. Kasi obviously, itong vax-cert is most useful now na hindi pa tayo nag-herd immunity. Kasi ibig
Tama.
sabihin, matagal ko na kasing ina-advocate yung idea ng business bubbles na ibig sabihin, if there are spaces na safe, ibig sabihin, bakunado ang empleyado, bakunado rin ng mga clients, bakit hindi natin sila hayaan to operate kahit na may tawag ng ECQ, di ba? So, and the way na, and it would seem like based on the news this morning, mukhang nagiging open ang business sector sa ganon. Ang tawag nila bakuna bubble. But basically, for that to happen, you need to be able to show an ID. Di ba? Na, bakunado kaming lahat dito, kaya pwede kami mag-operate. Or bakunado ako, kaya payagan mo ako magpagupit dyan sa salon na yan, na kung saan bakunado lahat. So for that to operate, you really need to have a credible, standard, or uniform vax certificate. So sa tingin ko, very useful siya sa ngayon, especially na wala pang herd immunity. But once you achieve herd immunity, the usefulness of that vax cert is diminished. Because nga, like I just came from the US, in many places, alam nyo, never po ako hinanapan ng vax cert. Even entry, sa airport, sa kahit na saan, never ako hinanapan. And I think it's because herd immunity na sila. Diba? In which case, well, the reason for why I'm saying this is, my question is, ano ang timelines natin? Kasi the sooner that we're able to roll out the vax-cert, which I believe is really, a very, very important initiative, and I congratulate you for that. Pero the usefulness is diminished greatly if we wait longer, diba? So, yun po.
Sec Manny, you're muted.
Mr. Chair, let me highlight lang po. Isa po pala, panglima po pala dun sa readiness, why we need September pa, is we are also getting the services of contact centers. Kasi po, pag wala pong contact center na mag-access dun sa vax-cert, kawawa naman po ang LGU at madudumugin niya ng mga request kung yung alam mo yung usage error lang po ng tao, simple usage error. So meron pong contact center na pwedeng sumagot, umalalay dun sa tao para hindi naman lahat pupunta na siya diretso sa LGU dahil nahihirapan lang siya sandali dun sa system po. Yun lang po. Thank you, Mr. Chair.
Hindi po yung timing ng pag-roll out nitong vax-cert or timing ng
Mr. Chair, alinsunod ma'am. Alinsunod po sa utos sa amin as coordination with the NVOC at sa NVOC lalo na ma'am. Ang minarapat at sa recommendation din po ng aming mga members ng technical working group on this one ma'am. Ngayong September po ma'am, Mr. Chair, ano po muna ma'am, NCR saka OFW muna para ma-perfect muna natin yung kakayahan ng LGU alalayan ang mga magre-request doon sa mga no records found or yung magpapapalit po ng datos para mag-reflect parehas sa kanyang passport and whatever po. Thank you po, Mr. Chair.
Okay, salamat. Isang huling tanong na lang, Mr. Chair. Nabanggit nyo kanina, Yusek Manny, na kayo po ang nag-a-administer ng IT systems ng DOH. So kasama po ba dyan yung daily reports ng COVID cases? Is that part of your responsibility po?
Thank you po, Mr. Chair. Ma'am, Mr. Chair, I'll bring up the slide po, relevant. So apart pa po from yung kaninang napakita niyong vaccine information system, ecosystem, di ba, marami. Apart from that po, ma'am, yan po, ma'am. So apart from that, yun kanina, yung table, nawala. So nandun po, ma'am, I'll start answering your question, ma'am. Yung COVID kaya po, ma'am, gamit po yan ng Epi Bureau ng DOH. Taruin ko lang po, ma'am, ang DICT, sa vaccine, medyo, parang kami pa medyo ang naghahawak. Pero ito po sa other systems po, imagine niyo, ma'am, yung data, di namin nakikita. Yung system na gumatak po, ang meron kaming responsibilidad, pangalagaan na up siya, or kailangan siyang buhay at gumagana ang system po. Pero yung data po, ma'am, safeguarded po yan ng Epi Bureau. Lahat po to, ma'am, 1, 2, 3, 4, 5. Pag down yan, kami tatawagan.
Okay po. Okay po.
System kami. Pero pag ang datos po, DOH lang po, ma'am.
Opo. Pero so kasama sa sistema kasi ang consistency checks for data integrity. Tama po?
Tama po, ma'am.
So may I know, meron bang, what are the built-in measures within COVID Kaya, which is I believe the system for the data drops of DOH. Yung tinatawag na data drop, ibig sabihin if I want to check the COVID cases on a daily basis, I'll just go to DOH and get the data drop. That's COVID Kaya, hindi po ba?
Yes po, ma'am.
Opo. So I want to know, and ang isa kasing criticism dyan is hindi masyadong accurate yung data. In fact, may footnote doon na sinasabi talaga na it changes on a daily basis. Ibig sabihin, kahit nag-report ka ng 100 cases today, maaring magbago yan bukas kasi syempre may mga late, may mga kailangan linisin na data, etc. So I'd like to know, can you let us know kung ano-ano yung mga built-in na data consistency check measures within the COVID Kaya system?
Ma'am, I wish I could answer you.
Yung duplicate names.
Ma'am, I wish I could help you. I answer, ma'am. Pero yung sabi ko kanina, in the case of itong mga case tracking, safeguarded po ng Epi Bureau, ma'am. Kasi sila lang po ang may hawak at nag-manage ng data, ma'am. Ang amin, ma'am, is
yes, but I'm just saying, yes. I'm just saying from a system perspective. I understand that you don't have access to the data itself, but the system itself, many data systems would already have in the program built-in data consistency checks such that kung nilagay mo Stella Kimbo 3 times, bibilangin nila na isa lang. Diba? So ano yung mga ganong klaseng, yun ang tanong ko, basically, meron ba nun? Ano-ano po yung mga yon?
Meron po, ma'am, pero di ko lang kabisado lahat, ma'am. Meron pa ako ibang team na pinatutok
sige.
on this.
Submit na lang siguro sa akin para maintindihan ko yung system. Submit lang po, share. And
yes,
then,
kung Epi Bureau din po.
Kung na-compute po yung, and huli na lang, Mr. Chair, kung na-compute yung, yung cost for the LGU to operate a DVAS. Na-compute na ba? At kung hindi naman, Mr. Chair, pa-submit na lang din po.
20,000 per lane. 1 lane po, ma'am. 4 po yan, ma'am. Registrar, screener, vaccinator, post-admin. Kasi 5,000 per tablet per lane. So kung halimbawa ang isang mega site may 10, 5 lane ang isang mega site, 100,000 po yon per 1 mega lane, ma'am. So tapos 2,000 per month sa internet.
Per day, month?
Opo. Yung may internet po, ma'am, yung cost naman namin sa internet.
So yung 20,000?
One time lang po yung tablets, ma'am.
Per month or per day?
Di, ma'am, one time po yung equipment, ma'am.
Sorry.
Hello?
20,000 is for the equipment.
Opo, ma'am. Per lane po. Hello, ma'am. Mr.
Kong
Chair.
Stella,
Okay.
your
Some more is what's that? Am I back?
your signal is
Hello?
unstable,
Am I
Kong
back?
Stella.
Oo nga. I know. Am I back?
Yes. Yes, Kong Stella. Please
Am I
wrap
back
up.
po? Am I back?
Mm.
Yes
Yes,
po.
Kong.
Ipapasubmit ko na lang po, Mr. Chair, yung costing ng hindi lang ng gadgets, kung hindi ng manpower requirement, encoders,
Okay.
etc. Per month. Diba?
Okay
Para
po.
malaman ng LGU magkano ba ang cost out ko dyan. Para ma-enganyo sila gumamit ng DIVAS. And at the same time, they do not spend 10 to 15 million for developing their own DIVAS.
Opo, ma'am.
Okay,
Sige po,
yun lang po. Salamat, Mr. Chair. Magandang
Thank you,
hapon po.
Kong Stella.
Salamat.
Next in line is Congresswoman Janet Garin. You're now recognized.
Thank you, Mr. Chair. Yeah, Mr. Chair, this is not a question, but this is a comment. Kasi ito yung naging issue kanina. This was the subject matter of a lot of questions of the Honorable Swansing. And I just wanted to contribute to the information for purposes of clarity. The yellow card is otherwise known as an international vaccine card. It's a vaccination card duly recognized by IHR, or the International Health Regulation, that is the body surrounding, aligned with the World Health Organization. So kailan po ba ito ginagamit? Meron pong mga bansa that are known to be endemic for some illnesses, no? Like malaria. This is very dominant in yellow fever in areas of Africa. At ang ibig po sabihin ng yellow card or international vaccination card, ito inire-require sa mga bansa na endemic for some diseases, kaya ang travelers to that area are required of specific vaccines. At in contrast, no, kasi nasabi nga kanina ni Yusek Kaintik na yung vaccine card has this, the vaccine cert has this data, whereas the vaccine card will only, pareho po ang data dun sa dalawa. So even the lot number, the batch number, the manufacturer of the vaccines, all the data that you see in a vaccine cert is similar also to the data that you see in an international vaccine card. It's just that, of course, in yellow fever and most of the illnesses, one shot po ang vaccine as compared to other illnesses na kagaya ng COVID that can actually be 2 or 3 shots, no? And moving forward, bakit hindi ba sila pwedeng emerge? I really think this can be merged. However, the international vaccine card has been used to protect other citizens in a few countries who have an established endemicity for some infectious diseases. In the case of COVID, it's pandemic. So buong mundo. Kaya siguro dun na pupunta ang kalituhan between the Vax Cert and the international vaccination card. Kasi ang yellow card or international vaccine card, meron din po kasi yung tenure bawat bakuna. Like itong isang bakuna na to will last for 5 years. Ito naman will last for 10 years. O ito naman will last for 15 years. Biglang sinabi ng WHO, oh, yung ibang mga bakunang nakalista dyan, nagkaroon na ng bagong pag-aaral. Wala na yung expiry. Tuloy-tuloy mo na yan na magagamit. So those are basically and it's not true, no? Kasi kanina I heard, I am not sure, no, one of the resource persons saying na, hindi, pag may yellow card ka, kanya-kanyang data yon. Hindi na verify. No, it's an international database because it's part of international health regulation. It's part of surveillance. And you're also required to report back each batch, each lot number to the manufacturer and to WHO for the utilization of the vaccines. So just for clarity. But the reason why it's being incorporated into the international vaccine card as of the moment, because there is no document that is aligned internationally to document COVID vaccination. However, my point in isa lang po sana kasi ang tanong ko eh. Pero hearing the other statements, medyo nadagdagan ng konting tanong ko. Mr. Chair, pandemic po ngayon. And many people are losing their jobs. We have a lot of expenses. PCR testing, mga quarantine na minsan hindi naman libre. I'm not sure if the government can just waive this 300 pesos for the international vaccine card. Because the government is actually giving also budget naman, di ba? Magkano lang naman ang cost ng papel na yan. I also remember when there was an outbreak of polio, and then when there was polio-associated, it was actually VAPP and VDPP, the vaccine-associated paralytic poliomyelitis and the vaccine-derived paralytic poliomyelitis. Ito rin yung pagkakataon na biglang kapag galing ka sa Pilipinas, lahat ng OFWs natin ni-require ng additional polio vaccine. So idinagdag doon sa requirement na kapag kahit Pilipino at bibiyahe as overseas worker, yung yellow card mo dadagdagan ng IPV, which stands for inactivated polio vaccine. Nagkaroon rin ulit yun ng bayad. I'm not sure if the fee was 150 or 200 pesos or 300 pesos. Pero yung bakuna naman, binibili ng gobyerno yun. It's supposed to be free. So my point is, can this committee and our other colleagues move to do away with the 300 pesos? Because it's really, I find it highly unethical for us to be bleeding our overseas workers na sila ngayon yung inaasahan natin na magpadala ng pera sa kanilang mga kapamilya na nawalan ng trabaho. So that's my message to our resource person and to the leadership of the House. Let's waive the 300 pesos payment to the Bureau of Quarantine. And kung ano man yung operational cost, office supplies ng Bureau of Quarantine, baka pwedeng idagdag na lang yan sa kanilang budget. Because when the polio outbreak happened in the Philippines, hindi po namalayan ng karamihan. Pero nakita nyo na ang haba-haba ng pila, may bayad pa. Pero yung bakuna is being bought by our government. And again, that's taxpayers' money. Moving forward, Mr. Chair, of course, I don't want to prick the bubble of USEC money. Pero kasi ilang beses ko narinig that you mentioned na because of your system, napabilis yung pagbabakuna. I maybe, no? Pero ako personally, on the ground, having been exposed to many vaccination centers, I don't see that. Apologies, pasensya USEC, pero I don't agree, no? Kasi ang nakita ko po dun sa baba, medyo hirap yung mga RHUs, hirap yung mga city health offices kasi naghahang palagi. And during the first implementation of the vaccination program for several months, 5 beses po pinaulit, nag-encode na sila, andyan na yung line list, biglang may memo ulit, ay, back to step 1, encode ulit. Later on, ay, back to step 1, encode ulit, may bagong memo. Oh, ikaw encode ulit, bagong memo. So what did we do? Because we have been supporting rural health facilities and city health offices with manpower, vaccinators. Syempre, encoders hindi pwede kasi galing daw dapat sa inyo yon. We just resorted to manual. In fact, I conveyed this to Secretary Hunasan and he assured me that he will link me up with you. Pero siguro na busy. Kaya hintay nga kami. And I hope that this opportunity will also give us an opportunity to get your number or the number of your staff para pag may kailangan, madali kaming makalapit. No? But be that as it may I inquire from you, Sec. Kaintik, no? Kasi narinig ko ilang beses that you mentioned na nagiging mabilis at hindi napapagod yung vaccinator because the way I'm seeing things on the ground, hindi naman po yung vaccinator yung nag-encode. So how can the system fast track the vaccination process? No, if we can make a quick run through, quickly lang po sana.
Thank you po, Mr. Chair. Thank you po, Mr. Chair, Congressman Roman Garin. Yung DIVAS po, sabi ko nga kanina, unfortunately, ilan pa lang po talaga ang gumagamit. We are encouraging, first and foremost, LGUs to have a vaccine administration system. Kasi yung marami pong LGUs, wala po talagang system na ginagamit. Di papel po from umpisa, tapos dadalhin niya yung papel sa sunod na stage, tapos dadalhin na sunod. Kaya sa dulo po siya i-encode. So yung tawag po doon, line list encoding. Meron din po tayong binigay na facility, ma'am, na line list encoding end of day. So tama kayo, kung di papel yan, magtatagal
Yusek, Mr. Chair, Yusek, pasensya lang
Ibas, yes ma'am.
po, no, if I may be allowed to interject. Yeah. Mr. Chair, Honorable Yusek, ang ibig niyo pong sabihin, ang pagkaintindi niyo dun sa vaccination site, pagka nagpabakuna yung tao, dala niya yung kanyang health declaration form at consent form, pagkatapos dun pa ini-encode before umalis,
Sa dulo
ganun
po,
po ba
ma'am.
ang nangyayari?
Sa dulo po.
Because that's
Opo,
not
ma'am.
what I'm
Ang
seeing on
nangyari,
the ground. Yes, sir?
Yes po, ma'am. Yung pong hindi gumagamit po ng vaccination, kung konti lang, ma'am, hindi mo pa siya mapapansin. Pero pag marami po yan, ma'am, sa dulo po ang encoding, sa encoding po, hahabulin po i-encode sa isang table ang mga data. So tama, no? Baka isipin nyo na ang papel, mas mabilis kasi sige, go, go, go. Pero ang mangyari sa dulo, hindi pa sila uuwi kasi may mag-i-encode pa po at minsan magtutulungan na sila mag-encode. Ang sa DIVAS po, ma'am, pag upo mo po, lalo na kung
Yusek,
nag-submit
if I may Yusek, if I may, no, Mr. Chair. Ang pagkaintindi ko kasi, when we talk about encoding, hindi pwedeng maski sino lang ang nag-encode sa bawat RHU, okay, at sa City Health Office. There's an IT person that has been designated na trained po ninyo, trained din po ng DOH, at yung IT person na yun lang talaga ang nag-encode. And I think that is where the bottleneck is. Kasi isang tao lang ang nag-encode at maski kunyari yung mayor magdadagdag ng mga tao, yung congressman, yung kanyang mga government interns, like ako, lahat ng GIP ko, dinistribute ko dun sa mga vaccination centers, RHUs, and quarantine facilities. But the problem is, yung encoder nyo, isa lang, bawal ng iba. So with your statements, I'm really sorry, I had to correct this because I think it will also be good for you to look at the situation on the ground. The bottleneck, Mr. Chair, Your Honors, lies on the fact na kunyari ako yung encoder, ako yung trained, ako lang ang pwedeng gumalaw ng computer, nobody else. So pwedeng dagdagan yun ng tao. Pangalawa, ang vaccinator, ang screener, ang nagpo-post vaccine counseling, they are not involved in data encoding. So just to correct, no, kasi I heard you mention several times na yung vaccinator, pagod na pagod sila kasi sila magbabakuna, sila pa mag-encode. It does not happen that way. Kasi that there will be a lot of contamination. Meron po kasi delineation yun. And what's happening on the ground, sa totoo lang, kapag wala ka sa database, except siguro you're referring to big cities in Manila, pero karamihan po, no, ng mga areas sa buong Pilipinas, yung nagpupunta at yung binabakunahan, yung naka-pre-list lang, nakalista ka na sa database. So there's really no encoding on the grounds. And why am I conveying this? Because if we market DIVAS to the LGUs, and you do it that way na magiging mabilis to, o ito ganito, hindi nila papaniwalaan yon. Kasi yung vaccinator talagang hindi nag-encode. Even the nurses, the medtechs, the aides, the volunteers, they cannot encode because encoding is only given to a specific person. Pangalawa, ang ginagawa po kasi ng karamihan, meron ng iniipon na ng mga barangay, di ba? And then naka-fill up na doon, then pinapasok sa database. Yun yung nagiging basis nila. At pag binakunahan sila, they just sign the consent, may checklist doon tumatagal yung checklist at interview ng health worker or ng doktor, at kapag may comorbidities, doon tumatagal. No? So I'm just sharing it because there must be another way of marketing it to our LGUs. Pero hindi po talaga totoo na nakakapabilis siya ng system kasi pre-encoded na nila, pre-listed na nila eh. Bawat barangay may lista na. But I still agree with you that database should really be improved. Moving forward, Mr. Chair, yung sa ano po, no, yung sa Vaxxer PH, wala pong ano yun, di ba? Wala pong bayad. Like
Yusek
for
Manny?
ordinary Filipinos.
Wala po, ma'am.
Oo. So wala siyang bayad, no?
Po, ma'am.
Oo. Because the way I see it, in just a point of suggestion, Mr. Chair, I mean, 2 cents of unsolicited advice. If there's one big thing that Vaxxer PH can contribute, that is actually to do away with fake vaccine cards. Yun sana ang maganda niyong sabihin. Bakit meron tayong Vaxxer PH? To make it convenient for people and to make it convenient for all organizations, including those who will have bubbles, to validate whether this person is vaccinated or not. Kasi kung titingnan mo, ang dali nang gumawa ng vaccination cards eh. Ang dali na rin magpeke ng vaccination card. Pwede ngang ilagay lang yung pangalan dyan ng isang doktor o isang vaccinator at then pirmahan. There's even no way that we are being able to verify the signatures of the vaccinators on the card. So the beauty and the main issue of the program that you're doing is convenience for our people, our government agencies, travelers, and to make sure that there is a legitimate source of actually vaccinated people. Baka po pwede nating i-tweak ng ganoon kasi yan naman po ang totoo. And that is also the reason why worldwide there will really have to be a uniform source of vaccinated people for purposes of verification. Yan po sana, no? So last, Your Honor, my last question is, ano ba ang requirement pag nag-a-apply? Sorry, I have another question. Dalawa na lang po. Yung dun po sa application ng yellow card or the international vaccine card, what are the requirements? Kasi nagugulo po ang mga tao eh. If we have maybe Dr. Eric Taya here or any representative or maybe DICT is also aware. Ano ba ang requirements, no, sa pag-apply ng international vaccine card?
Director Eric, maybe? Director...
And is it to be in person or pwedeng online?
Okay. Thank you, ma'am. Yung Bureau of Quarantine, sana nandito din sila. Nire-require, ma'am, yung international vaccine certificate, gaya nga ng sinabi nyo, sa maiksing listahan ng mga sakit. Halimbawa po yung yellow fever na kung saan ay
Eric, sorry. Sorry, Mr. Chair Eric. My question is, ano ang requirements pagka nag-a-apply ng yellow card? Let's say I'm an OFW. I have to apply for a yellow card for my COVID vaccination kasi ngayon wala Vaxxer PH. Ano ba yung mga requirements?
Okay. Ma'am, sa...
And is it in person or online?
Okay. Ma'am, ito po ay lahat online para na sa ganun hindi nalalagay po sa delicate or risky situation po yung mag-a-apply po. So, pag sinimulan na po namin itong Vaxxer PH with the DICT kasi sila po nang mag-manage, meron pong domain name na kung saan ay pwede po nilang ma-access po yan. So, may website po. So, may hihingin po sa kanilang mga datos, personal information. Katulad ng pangalan, edad, pagkakakilanlan, ma'am, para yun ang paraan para ma-verify po sapagkat ibabangga po ito doon sa database na nasa VIMS o DIVAS. Kung yun po ay makikita ka agad, mabibigyan po siya ng certificate. So pwedeng siya na po ang mag-print nun o pwedeng ipapakita po niya yung digital At yun po ay mari namang i-verify
So,
kung
Eric,
sino man yung humihingi. Yes, ma'am.
just to verify, no, ang nagiging yellow card ngayon ay digital na or pwede mong i-print sa bahay. You don't necessarily have to go to BOQ.
Ma'am, yung sa BOQ po, ganito po ang kwento ng International Vaccine Certificate. Yung yellow fever, dahil hindi po vaccine, hindi po available, kailangan kang pumunta po sa kanila.
Hindi. Sorry,
Opo.
Eric, I just
Opo.
have to cut, kasi
Opo.
mako-confuse yung ating mga
Opo.
ibang mambabatas. The international vaccine card or yellow card for yellow fever, you really have to go to the Bureau
Opo.
of Quarantine because you have to be vaccinated
Opo.
there.
Tama
Kasi
po.
yung supply ng bakuna ando doon lang. But let
Opo.
us not confuse. No?
Opo.
Sorry, Erica, I'll just go.
Opo.
Let's talk
Opo,
about
ma'am.
COVID. Okay,
Opo.
ang pag-usapan natin yung COVID. I am an OFW. Sa ngayon, wala pang Vaxcert PH.
Opo.
Ang nire-require sa akin, kasi sasakay na ako ng barko, is an international vaccine card na meron ding COVID vaccination data. Okay.
Opo.
So, paano ba ako mag-apply? Is it online or kailangan
Ma'am, okay. Ayon sa impormasyon binigay sa amin ng
pumunta sa
Bureau of
DOT?
Quarantine, ma'am, online din po yon. Tapos may hinging mga personal information. Tapos, humihingi ng kopya ng vaccination card. So ito ma'am, magkakaroon ka ng online appointment para sa ganun, maproseso po ang iyong request. So parang ano po, parang pumipila ka sa pagkuha ng passport. Yun po ang sistema ng Bureau of Quarantine ngayon. So pupunta ka sa site po nila.
Pupunta ka sa
pipili
site,
ng,
magkakaroon
pipili
ka ng
petsa.
appointment.
Opo.
Okay. Tapos yung dun sa appointment, ipapakita mo yung vaccine card.
Opo.
Okay. Pag pinakita mo yung vaccine card, bakit nagre-require pa ng certification sa local government unit? Kasi ang nangyayari, yung ibang OFWs, bumabalik pa kasi kailangan daw talaga ng certification. So alam mo yun, pabalik-balik sila. So that's why I'm opening this up. Maybe we can come up with a system that will make it friendly and simpler for OFWs. And I believe my colleagues here will agree with that.
Okay. Ma'am, talaga pong ganun ang nangyayari ngayon. Kaya nga po, importante itong Vaxcert PH para na sa ganun, kung naayos na to, ay hindi na po ang Bureau of Quarantine ay magbe-verify sa LGU. Dito na po sa Vaxcert PH. Para po malaman natin.
Eric, may question lang ako. Ha?
Opo.
Okay. Di ba merong VIMS IR? We have the line list.
Opo.
Okay. Pag nagbakuna ang LGU, lahat ng binabakunahan, andun ka sa database. Nakalista ka dun sa database. Ngayon, pag nabakunahan ka na, nire-report mo rin dun sa line list, nilalagay mo na yung serial number, ito yung date of vaccination, ito ba i-first dose, nilalagay mo na yung second dose. Pagkaintindi ko, yung data ng LGU, tinatapon na yan sa depository ng information sa probinsya, sa DOH region at DOH national. Hindi ba pwede na yung data na yon na may kopya naman supposed to be ang Department of Health, yun ang sisilipin ng BOQ. Kunyari, mag-a-apply ako na OFW. Kasi yung ating mga municipal health offices and RHUs, and I hope DICT is also here, baka kung pwedeng magtatulungan dito Yusek Manny, masyadong busy lahat. Busy sa isolation centers, busy sa quarantine centers, busy sa swabbing, busy pa sa pagbabakuna. Not to mention, meron pa tayong other public health programs. Meron pang other vaccines, meron pang prenatal, meron pang TB, nagre-rabies pa tayo. So, ngayon, kung idadagdag pa na kailangan pa ng certification sa LGU at sa municipal health officer na nabakunahan itong taong to, kasi syempre baka hindi masyadong pinapaniwalaan yung vaccine card. Hindi ba pwedeng silipin na lang doon sa database, doon sa sinubmit sa VIMS?
Okay. Ma'am, thank you po. Tama po kayo. Kaya lang po, nang tinitesting po nila yan, maraming records ang hindi po matagpuan. At isang dahilan, may wrong spelling ng pangalan, mali yung petsa ng date of birth na binigay niya ron sa vaccination card halimbawa, at iba yung nasa listahan ng VIM sa immunization registry, hindi na po magmamatch. Kaya nga po, ang ginawa ni na DICT, may contact center para kung hindi magmamatch kasi within 3 days tapos mabigay yung certificate, ay kokontakin po nila yung local government unit para sa ganun, isang paraan yun para yung mga record mag-match at ma-validate, ma'am.
Nako, medyo malaking trabaho pala ito.
Opo, ma'am.
So,
pero yung tama yung sinabi nyo, ma'am. Kasi kung nandun na yung listahan, so may database tayo, ma'am. Kaya lang, pag nag-apply po, posibleng halimbawa ako, Enrique, ang naibigay ko rin sa nang nag-a-apply ako, Eric. Hindi po magmamatch po yun.
and it boils down, Yusek Manny, siguro at Yusek Eric, ang siguro kasi like kami recently, we actually submitted this to DOH, nag-dry run na kami, no? It's a combination ng virtual assessment, virtual pre-vaccine counseling, virtual post-vaccine counseling, and drive-through vaccination. So ang nangyayari doon, the usual, ini-encode nila yung data. So pag mali ang pag-encode nila ng data, malalaman mo kasi on the day of the vaccination, magpapakita pa sa sila ng kanilang government-issued ID. So the data in the government-issued ID should tally with the database. So yun yung ginawa namin. Tapos may mga staff na lang na taga-correct dun sa 9 list. Why don't UH expand? I mean, I can give you the process of what we have done para i-expand na lang yan sa lahat ng LGUs. Kasi kunyari, ako, Janet, naging 1T. Tama ka, magiging mali na dun sa information. But we can, while the vaccinated will already be corrected, the future vaccinees will not have that similar problem again.
Okay.
Kasi ang isa, tsaka maybe we can devise a system na hindi na RHU ang magva-validate. Maybe we can give that task, no, to another agency, or maybe, you know, if maybe there's a way, I'm not sure with DICT, Yusek Manny, is there a way na kunyari ako, pumasok ako, makita ko ngayon yung aking pangalan na mali, pwede akong mag-email at i-correct yan. Because if we're going to go back at magpaparoon ng mga certificate from the vaccinators, and then patuloy na dumarami yung binabakunahan, medyo never ending. And we will again hear that complaints from our overseas workers.
Okay. Ma'am, permission to speak, Chair at Ma'am. Ma'am, ang isang missing element dito ay unique identifier. Kasi kung may unique identifier, bawat isa sa atin, hindi na tayo problema sa pangalang na iba spelling, sa petsang date of birth na iba. Pero sa ngayon po, wala kaming magamit na unique identifier.
There is a number. Di ba may ini-issue, di ba yung una vaccine card lang yung binigay? Bakante yung mga vaccine ID number. Puro bakante yon. Then a few weeks ago, you started giving out the vaccine ID number. So yung mga na-register na, maybe we can ask the ICT about the system. Yung mga vaccine ID number, sorry, medyo hingal na. Yung mga vaccine ID number, Yusek Manny, is that coming from you? Or is that coming from DOH?
Mr. Chair, wala po ngayong way para yung vaccine ID numbers kasi nga po, ang nangyari po mula nung March na nag-start tayo kaagad, we allowed, ang focus muna is to vaccinate as many people. So we are really highly dependent on the quality of the encoding on the ground mostly after na po the vaccination event.
Yusek Manny, sorry ha. Yusek Manny, in the vaccine ID, may nakalagay yan sa taas, ID number. So simula nung March, naging bakante yan. Pero 3 weeks ago, or maybe almost a month ago, nag-release na ng mga ID number. Na kunyari, yung pagbakante yung vaccine ID number mo, pwede mo nang tanungin, ano yung ID number ko? Nagre-release sa mga LGUs. I think that's all over the country. So who is issuing this ID number? The
LGU.
Please wind up, Kong Janet.
Oh yes, Mr. Chair. Can we just have that answer? Who is issuing the ID number?
LGU lang po yun, ma'am. Tracking number lang po nila yon for their vaccination event.
So hindi yon aligned. So yung ID number na nasa vaccination card, walang kwenta yon.
Unique code nila yon for that LGU po, ma'am. So they could be recurring numbers po. That's why our source of truth is really the uploaded line list after the end of the day po.
Okay. And maybe Yusek Money, can you have somebody in your office para yung dun sa area namin? Last question, Mr. Chair.
Madam,
Bakit naman po NCR lang at OFW yung sisimulan ng September? Kasi sa bakuna nga, nahuli na yung Visayas and Mindanao. At ngayon kung kailan marami ng patay, sobrang maraming kaso na, nagkalat na ang Delta, doon pa kami nagkaroon ng bakuna. Ngayon naman, ang sasabihin, for dito sa Vaxxer PH, NCR lang. Marami rin kasi ang OFWs at travelers dun sa mga probinsya. So why are we limiting it to NCR alone?
Mr. Chair, Madam Congresswoman Garin, ang hinihingi namin, konting palugit lang na ma-practice lang yung data rectification nga na ipinagkakaloob natin sa ating LGU dito sa NCR, para lang muna ma-practice, ma'am, kung yung real on the ground na experience. So we can perfect it better. And then in a week or 2 weeks time, kung mukhang fluid naman, di ba may handover pa from contact center to LGU, gusto lang namin i-rehearse, ma'am. Pag naayos na, ma'am,
okay.
Dato billing nationwide, ma'am.
Okay,
ano
I got it.
Something minsan ang theoretical, hindi parehas sa practice ba?
Okay,
Yung,
Yusek Money, ibig sabihin, dry run lang yung September. But it does not mean to say na baka next year pa kami. So malamang yan, maka-dry run ng 1 month, October, all na.
Opo,
Sana
ma'am.
all.
Ang amin po pina-practice, ma'am, is yung handover from contact center to LGU, yung tipong,
okay. Yusek Money, yung
ma'am.
mga contact centers nyo, are they all in Manila or meron sa mga probinsya?
We asked po, ma'am, a multilingual support, ma'am. So,
No. Like, okay, kung nasa Iloilo kami, nasa Visayas kami, can we have access to your contact center?
Yes po, ma'am. Yes po, ma'am. Multilingual support po, ma'am.
Okay. Sige, maraming salamat po, Yusek Money, and I intend to get in touch with your office more.
Yes, ma'am. We wish
and
to
see how we can help each other.
Yes, ma'am. We wish to invite you po, ma'am, for a one-on-one session on the systems, ma'am, whether DVAS, line list, at saka Vaxxer, ma'am. Thank you po.
Yes, we are willing to do that. Not just give us a contact person. This will be virtual, no?
Opo, ma'am.
Huwag mo akong imbitahin sa office mo, magkakalat ako ng virus.
Ayun lang po pumasok, ma'am, after how many months, ma'am?
Yeah. Maraming salamat, Mr. Chair. Thank you very much to our resource person. And
thank you,
Mr.
Congresswoman. Yes,
Mr.
Congresswoman
Chair,
Janet.
Yung lambing ko lang, baka pwede nang i-waive na muna yung 300 pesos.
I think
Congress should lobby for that. We owe it to our OFWs and our
committee
people.
will take note of that.
Janet, that's a good idea. We'll push for that.
I support the motion.
I support
the
that likewise.
suggestion of Congresswoman Janet.
Thank you very much.
Thank you,
Maraming
Congresswoman
salamat.
Janet. Next in line is Congresswoman Mickey.
Good afternoon po, Mr. Chair, and good afternoon to everyone. Gaya din po ng tinanong kanina, I just want to reiterate po na kasi di ba Yusek Manny, nakakakuha ngayon tayo ng vaccination card. And you said a while ago na yung vaccination card may number, it's only a tracking number. But the problem is kaya marami din na gumagawa ng fake vaccination card kasi hindi po all LGUs may QR code. Ano po, katulad po dito sa amin, sa lugar ko, it's just a piece of paper na you have to be, na ikaw pa kailangan magpa-laminate para lang medyo tumibay-tibay ng konti. And yet, hindi po pare-pareho yung ayos ng vaccination card. Yung iba po, pag sa Manila, kailangan may picture. Dito po sa amin sa province, walang picture, okay lang. And yet, wala rin kaming QR code. Mr. Chair, my suggestion is, bakit po hindi gawing mandatory ang ating mga LGU na gumamit ng DBAS? No po, sabi nga may kamahalan, pero dapat po siguro gawin natin itong mandatory to make things easier. At yung mga process po is to make things easier then. Kasi po, Mr. Chair, Yusek Manny, sana po mapag-aralan din po ito. Kasi una-una po, pag yung tao nagpunta sa vaccination center, ini-encode din ng vaccinators yung kanyang ginawa ngayong araw na ito. Bibigyan siya ng tracking number, bibigyan siya ng vaccination card, sasabihin dito kung ano yung vaccine na ginamit sa kanya. Instead of doing all of this po, bakit hindi idiretso na lang dun sa system ng DBAS? Para sa ganun po, automatic lahat ng nabakunahan, meron ng vaccert. Hindi na po kailangan na yung hihingi kami ng kusa o magre-register kami under the agency po ng DICT just to ask for vaccert. Ngayon po, upon doing that, yung kunyari po kaming mga tiga-LGU, instead of gagawa kami ng vaccination card namin sarili, diretso na sa kanila sa DICT. Para DICT na ang magbibigay sa amin ng card, which is the vaccert na po. Baka pwedeng ganon. Kasi masyado pong maraming card na ang hawak ng ating mga kababayan. Kung ako po ay may vaccination card, ihingi ako ng vaccert. Gagawan na naman ako. Tapos isa pa pong problema, sana nakita din po, Yusek Manny, paano po yung ibang tao na ang telepono ay luma pa? Yung ating mga senior citizen o yung ating mga iba na walang telepono. Kahit po may free wifi kayo, kahit meron kayong kung ano-ano, paano kung luma naman pa yung mga telepono nila? Mr. Chair, sana po ganon mapag-aralan muli na sana po parang one-stop shop. Di po ba? Pag ni-register ni LGU yung pangalan ng tao na nagbakuna ngayong araw na ito, binabato na niya sa DICT para ang DICT po, nagre-ready na sila na ito gumawa ng vaccert at pabalik dun sa LGU. Baka po pwede ganon, Mr. Chair. Ano po pwedeng sagot ni Secretary Manny?
Yusek Manny?
Yes, ma'am. Thank you po, Mr. Chair. Ma'am, una ma'am, thank you for so much for the push. No? Tama naman po si Congresswoman Karin din kanina. Apart from the expediency, if there's a DBAS po kasi, may kasama po yung scheduling and queuing. Yung tanong nyo, yung suggestion, yung mukhahin nyo po ma'am is, bakit hindi na lang kasi minandate? Actually ma'am, may strongly worded NVOC advisories na. Some more, short of saying mandatory, kasi nga po ma'am, di ba may mga LGUs na may kaya gumawa ng sarili. Short of saying, ito ang gamitin nyo, ang wording na po is, kung wala ka, gumamit ka nito, please lang. Kasi, parang gano'n na po ang pagka-wording ko lang kabisado yung wording. Parang gano'n na po ma'am. Ang major challenge nga lang po is yung kagamitan. Kasi na-train na rin po sila. Pero ma'am, dahil nga sa tulong ng USAID, World Health, parating na yung mga devices, ibibigay namin yung lahat para yun yung gamit. Kahit isang set lang per LGU, malaking bagay na eh. Tapos ma'am, yung tanong nyo, yung parang garin na kay Congresswoman Garin, bakit hindi rin pwede na simulat sa poll, may code bago pa siya binakunahan? Para na sa ganon, na-track natin sa properly. Ganon din po pag gumagamit ng DIVAS. Meron pong LGU code, tapos yung number, by numbering. So alam natin, totoong nangyari yan sa gumagamit na DIVAS. Unfortunately, konti pa lang gumagamit. 200, 100 pa lang LGUs. Malalaki yung iba, pero mahaba pa naman itong laban, ma'am. So, mahahabol pa namin yan sa inyo, Congresswoman Galago, hopefully. Okay, IATF, ayan na po, without prejudice to the use of the LGU's own database system. Tama nga, ganun nga, no? Meron na po, hindi na po siya, ma'am, utos na po yan ng IATF. Kung wala ka, gamitin mo to. Without prejudice, siya yung gumawa na ng sarili. So, ganun na po yung answer po ng IATF. Tapos ano nga yung pangalawa mo, ma'am? Ang idea, ma'am, is kung gumagamit kang DIVAS, hinahanapan po namin ng paraan, ma'am, na bago ka umuwi, pag okay na to lahat, ma'am, ang idea namin, ma'am, is sana bago ka umalis doon sa bakuna center, agad-agad lang available ang vaccine mo. So para, parang one stop na. Nandun ka rin naman alas 9. Pag alis mo ng alas 6, meron ka ng vaccine din. Pangatlo po, yung wala pong telepono, pwede naman pong ang mangyari nga, kung may ganyan, sa dulo, maghintay ka lang naman a few more minutes para ma-load sa database at maibalik sa yung QR. Hintayin mo na lang at baka kung kakayanin, mag-print out na doon yung taong walang smartphone. Para dun sa mga taong walang smartphone, makapag-print na kami ng QR. So, ma'am, continuous po ang aming pakikipag-usap sa ating mga kasama dito sa working group. Continuous improvement naman po ang vaccine information system na sana ang DIVAS at yung vaccine in the end, all in one-stop shop na po, ma'am, one go, habang nandun ang tao, ma'am. Pero pahabulin lang po namin, pahabulin nyo lang po kami sandali, ma'am. Thank you po.
Mr. Chair.
Congresswoman Mickey.
Sana nga po matulungan natin sila na maayos tong sistemang to dahil marami din po talaga tayong mga kababayan na nais nang pumasok o magtrabaho ng muli, bumalik na sa ibang bansa. Pero dahil nga po maraming hinihingi at nagkukulang tayo sa kanilang pangangailangan, sana po matulungan ng Congress ang DICT na maipa-implement na po ito agad sa lahat po sana. At sana po sa DICT, wag lang po NCR ang tignan natin. Kasi hindi lang po NCR ang may kaso. All around po the country ay may mga cases. Yun lang po, Mr. Chair, and thank you so much po. Thank you.
Thank you, Congresswoman Mickey.
One sentence rejoinder po. Ma'am,
Yes.
Mr. Chair, yung marami pong participants namin ngayon actually outside NCR. Tuntua kami, ma'am, kasi ang DIVAS, ang mga nagsiseryoso gumamit ng DIVAS, yung mga nasa probinsya po, Zamboanga, Visayas and Mindanao, Luzon, Visayas, Mindanao, outside NCR nga po. Marami po, pero ang tanong, bakit hindi pa mag-umpisa? Yun lang yung kagamitan po. Pero marami pong takers, ma'am, outside Manila. Kumbaga, excited na sila, na-train na sila, ready na sila, bakuna na lang ang inaantay, ma'am. Thank you po.
Thank you, Yusek. Before I hand back the chair to Deputy Speaker West, may I be clarified, Yusek Mani? You said the Vaccert PH will be implemented September?
Yes po, Mr.
Parang
Chair.
dry run? We will have a dry run this September?
Yes po, Mr. Chair. Our target is on September, we will dry run an NCR and specifically for OFWs po muna. It will be properly communicated by our IATF Stratcom po, sir.
So after the dry run, bali isang buwan yung dry run? More or
Ay,
less?
Hindi po, sir.
Will take several months?
Hindi naman po, sir.
A
Ano lang,
week?
sir?
1 week?
Several weeks lang po. A few weeks. Para lang po ma-perfect yung processes, not the system.
So
Yung
by October, yung VACCERT will now be fully implemented. At least for OFWs and in NCR.
Yes po. Even outside po NCR.
Okay. Thank you, Yusek Manny.
Sir.
DS West?
Yes, Doc, I think we've gathered everything already. Everybody was able to speak already.
I have a question.
Go.
DSWS.
Yes,
Sorry,
go
I'm
ahead,
back.
Kong Kiko.
I'm
Yes,
back.
yeah.
Yusek Manny, ano lang, quick, two types of quick question lang because I can't remember if it was mentioned already. The first is, sinabi mo the system is in accordance with WHO criteria, no? Tama ba? So wala nang kailangang registration or accreditation ng system ninyo from the WHO.
Wala na po, sir.
Automatic na yan, recognized everywhere. Tama po ba?
Opo, sir. Kung nire-recognize ng kabilang bansa po.
Kung i-recognize ng kabilang bansa, meaning they are compliant with the WHO requirements. Okay.
Yes.
Second question then is, the system, as I understand it that you presented, is yung papasok at magpapabakuna.
Yung DBAS po.
Oo. Paano naman yung mga nabakunahan na?
Yung nabakunahan po, sir, most likely VACCERT na yung para dun sa mga nabakunahan na, most likely VAX certificate na hinihingi nila, VACCERT PH po. Yung DBAS po is yung para to facilitate the expedient vaccination.
Ano naman yung sistema ulit ng pagkuha ng VACCERT for those who are already vaccinated, let's say?
Ang VACCERT PH portal po sila mag-access, sir. Na
So they do it not via their LGUs, they do it themselves?
By themselves po, self-service po siya, sir.
So how do you know, alimbawa, kung ako gumawa ng aking sariling LGU at sariling vaccination card, diba? I go on your website and I go online and I register myself for a VACCERT. How do you ensure that mahuhuli niyo ako, for example? Kasi fake yung VACCERT ko if it's completely the onus is on me.
Okay po. Kasi po, dun po sa system, ibibigay mo po yung pangalan mo, complete personal detail. Ilalagay nyo rin yung details na nandun sa Vax card, yung binabot sa'yo nung binakunahan ka. Pag hindi natugma, hindi ka mabibigyan.
Hindi magtugma sa database ninyo na. So,
yes.
In other words, everybody who has been vaccinated up to today, let's say let's say September 1 bukas in NCR and you launch your system. So everybody who has been vaccinated, that data is current
in VIMS as long as the LGU sent it to the VIMS agad-agad.
How do you know? Ano nga yung agad-agad? Ano yung timeline lag?
Binibigyan, actually sir, Mr. Chair, Congressman, binibigyan sila everyday talaga dapat submit. But historically, our LGUs have at least 2 to 3 days delayed sila minsan.
So this is into the DOH vaccination database.
The VIMS po, opo. Submitting the line list. Updated sila lagi, boss, Mr. Chair, sa quick count. Kasi pinupukpok talaga ni Sectits, ilan na lang natira. Pero yung line list po, naghabol po talaga, sir, kasi kung lalo na nga kung wala kang DVAS, i-encode pa yun. So, habol po. Habol konti.
Okay. So, and then I think you've touched on it na. But the question is really the number of QR codes and database systems that the end user has to deal with. Kasi yun din ang tanong ni Tita Ging Swansing at actually yun din ang tanong ni Vice Chair Mickey Violago. Wala bang way na from the end user's point of view, imbis na kadami-dami, meron akong stay safe. Tapos kung lilipat ako ng LGU, iba na naman. 'Di ba? Each LGU has their own. And then if I have to get a vaccination certificate, I need to have another QR code. Is there any way that we can just have one QR code that then gets recognized by the different systems of DOH?
Thank you, Mr. Chair. Actually, boss, it all stems from the fact that we have no identifier of the person. Agree?
Kaya nga, but okay, so wala tayong national ID, di ba? Okay, so pagpunta ko at gagawan mo ko ng nag-register ako ng Stay Safe, halimbawa. Meron akong binigyan ako ng QR code. 'Di ba? So, meron na akong data dun sa QR code ko. Bakit hindi 'yon pwedeng i-recognize ng systems ng DICT at ng DOH?
I-aggregate lahat ng mga
I-aggregate lahat para ako isang QR code lang ang photograph ko sa iPhone ko halimbawa. Tapos if I go into one establishment, it's the same QR code because that QR code identifies me within one database, di ba? So can I not use that QR code's identification capacities for all the other database systems?
Okay, thank you, Mr. Chair.
And if the answer is no, why not?
Okay.
What are the obstacles to aggregating them?
Thank you, Mr. Chair and Congressman Kiko. Very good idea, no? It's very tempting to accommodate or to aggregate all the QRs that somehow represent the person. But it all boils down po kasi to we have two considerations. For me to accept that QR identifying you as Congressman Kiko Benitez, this QR to recognize me as Manny Kaintik, we have to be firm on the know your customer, KYC mechanism that went into that. Or else, there's a danger that we could be fabricating easily.
Okay, Yusek, baliktarin ko yung tanong ko. Okay, baliktarin ko yung tanong ko. Ang Stay Safe nang galing sa inyo. Tama? Galing sa DICT tsaka DILG yan, di ba?
Mr. Chair, it was endorsed by the IATF to be one which will be endorsed to be encouraged to be used by all the LGUs po.
Okay. So presumably that means that the recognition system of that QR code inaprubahan ninyo.
Pero sir, yung database po na yan is not with us eh. It's not the national identity system eh. Nakuha niyo sir, para sa sir, meron kang BPI account. Of course, BPI does their own know your customer. Meron kang Union Bank. Ganon din po siya eh. And I do not wish to, pasensya na po, I'm a firm supporter of having just one national identity system which we ought to have. And to create na po a diversion, baka po mawala ang lalo it might create a disincentive in unwittingly we might be creating a disincentive to enroll in the national ID po. And I'm a firm supporter.
Okay, but you said baliktarin ko. Okay. So, hindi ako nag-stay safe na ako, may QR code na ako, 'di ba? Galing sa Stay Safe. It's not the national database na controlled ng DICT tsaka ng DOH. Okay? At a certain point, the majority of the population is going to get that vaccination certificate.
Anyway, yes.
That's the idea. So, bibigyan mo ako ngayon ng vaccination certificate. 'Di ba? So, whatever it is, the 17% of the Philippine population that has been vaccinated
will have a QR code na nanggaling sa inyo, na nasa repository ng DOH. Tama?
Yes po.
Okay. Hindi ko ba pwedeng gamitin yan para sa airport, para sa establishments, so the reverse. Nanggaling sa inyo yung mandato that you will all use and incentivize all the end users to use your QR code.
Thank you, Mr. Chair.
Pwede ba yun?
The
At kung hindi,
certificate-
bakit hindi?
Thank you po, Mr. Chair. Very good line of questioning. I've been asked that several times. Mr. Chair, Congressman Kiko, the VaxCert is a certificate saying Congressman Kiko Benitez was vaccinated by this and that. But it is not an identity system. In fact, if I were to copy Congressman Kiko's, I keep on using example, nakuha ko yung QR ni Coco Martin ng kanyang Vax card. Pag binaril ko yon, lalabas yun, that's a validated, verified QR certificate na si Coco Martin na bakunahan. But it's not mine. The national ID, identity system, is the certification that I am who I say I am, was born this way, was born here, and that yung VaxCert is really just a certification stating na may nabakunahang manika intake nung araw na ito. Pero hindi ko po siya proof of identity, sir. That's why pag punta ka sa ibang bansa, pagpakita ka man ng VaxCert, sabi mo, valid yan na VaxCert, barilin mo yan, galing yan DOH. Manika intake. Oo nga, di ko naman sinasabing hindi fake ito. Pero hindi ikaw ito eh. Parang ganon.
Okay, understood. Sige, naintindihan ko, Yusek. Okay, so last question na lang, Mr. Chair, Deputy Speaker Gatchalian. Sinabi mo that you will have September 1 and then maybe a couple of weeks to fine-tune it, and then you will launch it nationwide. Tama? So how quickly is the uptake, and how quickly do you predict it will be pervasive for all of us to be able to use your VaxCert?
Thank you, Mr. Chair.
Yung 70% na nandun magagamit na nila. Kasi the other issue here is we've been talking about the yellow passport, di ba? The yellow vaccination cards or booklet actually. But there's a long wait list kasi ang Bureau of Quarantine ay undermanned actually to cope with the need, no, to generate these vaccination cards. So how quickly and how pervasive will the DICT's efforts that we can then say, bukas pwede na ako, may QR code na ako, pwede ko na pa-print out, pwede ko na whatever, daling ko na sa airport, nationwide for the vaccine?
Thank you, Mr. Chair. Actually po, Congressman Kiko, the system is available agad-agad, ubiquitously, because it is
Kasi
online.
it's online.
Online. Ang takot ko pa nga is the immediate pervasiveness at baka the surge of LG rectification, mabubulunan ang LGUs. Contact centers, I'm firm, I can add more, but although, syempre, limited yan. But the turnaround time might suffer. Yung di ba? Parang magpa-pile up ka na mag-queue. So ang akin talagang, ang aming hinihingi is konting palugit para makita natin yung time and motion, not so much on the pervasiveness. It's naturally ubiquitous eh. Ang takot ko is yung total, turnaround time, handle time ng calls, para makita ay kulang, dagdagan natin. Ay, baguhin natin to. Nakuha mo ba? Yun yung
So ang tanong ko pa rin, Yusek, is ano yung palugit na ginagawa mo for the load of transactions that you expected to have? Diba? Kasi as I said, meron ka ng 17%. Kung sabay-sabay kami mag-log online yan, paano? Wala pa yan yung uni-vaccinated na gagawin mo sa contact centers, di ba?
Yes, sir. Sir, ang aming pong palugit, ang aming throttle we will prioritize OFWs and international travelers. So we're throttling the flow. We will throttle the flow po. So kahit after NCR, nationwide man, OFWs pa muna din and everything, until makita natin na kakayanin mo na yung full blast. We will throttle the flow.
So kaya mo yung mga 300,000 in one day na OFWs halimbawa?
Huwag naman sa.
Yun lang
Huwag
naman
naman
ang tanong ko, di ba? How quickly
into
can you
that
absorb the demand if the demand is that high?
That's why we need the next few weeks to see the capacity of the overall system, including the capability of not just the IT system, but the people behind it.
Sige. I suppose we wait and see. Thank you very much.
But we will keep you.
Baka isang linggo pa lang mag-crash ka na eh. Mag-crash na yung website nyo eh.
Thank you po, Mr. That's why we need to throttle, Mr. Chair.
Thank you, Yusek Manny. Thank you, Kong Kiko. Well, we've discussed so many things. It was a fruitful session. Are there anybody else who wish to speak before we adjourn?
Mr. Chair, will we still deliver on the digital infrastructure plan, the update as requested by the Committee on ICT?
Siguro hindi na, Yusek Manny. It's already almost 1:30 and we have another hearing coming in. Anyway, we'll do that on a separate session. What's important is this vaccination program and anything related to COVID. Yeah. So, do I hear a motion to adjourn?
Move to adjourn, Mr. Chair.
Mukhang tayong tatlo na lang yata na iwan dito ni Doc Cato.
Marami pa po, sir. Marami pa.
Okay. Anyway, are there any objection? Hearing none, the motion is carried. Thank you, Yusek Manny. Thank you to our representative from DOH and DFA as well. And thank you, Kong Kiko and Kong Jun. Maraming salamat to.
Maraming salamat.
Thank you, DS.
Okay.
Thank you, Chair Kiko.
Thank you. The ComSec, thank you. All the ComSecs of the three committees, thank you. Yeah.
Thank you, sir.
Thank you, Yusek Manny.
Thank you po, sir. Thank you very much, sir.
Thank you, Director Eric.
Yusek Manny, padala mo na lang sa akin yung update mo ng infrastructure development plan. Gusto ko rin makita eh.
Yes po, sir.
Thank you.